Now we are going to discuss tubes, catheters and drain. You can see this is an image of Romovac suction drain. So how we apply this? It is a closed suction drain. You have seen in the wards that after emptying the bag, the resident is going to press the corrugations. In this you can see that these are the corrugations. These are corrugations. So how we are going to use it? The resident is going to press the corrugation, so suction is applied and after that it is attached to the tubings. So we create suction by pressing the corrugations and then we are going to attach it with the tubings. So this is closed suction drain. You have noticed that in which patients we are using this? You have seen the patients in whom thyroidectomy is done. In those patients we are using Romovac suction drain. Patients of mastectomy, beneath the flap, one limb of this drain is beneath flap and one limb is in the axilla, and it is also used in flap and reconstructive surgery. Okay, so what are the uses? So the Romovac suction drain, it is used in thyroidectomy, it is used in mastectomy, and it is used in flap and reconstructive surgery. There is another closed suction drain which was asked in AIIMS. So what's the name of this drain? This is Jackson-Pratt drain. In short, it is also known as JP drain. This is another type of closed suction drain. See, what are the parts of this Jackson-Pratt drain? So here you can see there is a grenade shaped bulb. What is the shape? Typical shape, grenade. Have you seen grenade? So there is grenade shaped bulb. Here you can see that there is stopper. These are the flexible tubings and this is the drainage end of Jackson-Pratt drain. See how we are going to apply this Jackson-Pratt drain. So in this picture you can see that this JP drain is applied. This is the part of bulb. So how we are going to apply? Here you can see that there is emptying cap. So we are going to open the emptying cap. We are going to empty the drain. After that we are going to press the drain. Can you see? Here this bulb is pressed. So the bulb of drain is pressed so that we are going to create the suction, and after that we are going to apply the cap. We apply the cap and then we relieve the pressure. So what? Suction is created. So what happens? The fluids are going to collect here. So generally in which conditions we are using JP drain or Jackson-Pratt drain? This is used to collect the bodily fluids in post-operative period. So here you can see it is used in post-operative period for collection of body fluids. Clear? So generally it is used in post-operative period. Okay, so there was image-based question related to Jackson-Pratt drain in AIIMS. Now see, this is commonly used tube both in medicine and surgery department, and what's the name? This is Ryle's tube, also known as nasogastric tube. First question which was asked many times related to this tube, that what is the ideal position of insertion? If a patient is conscious, you have seen in emergency how we are going to insert. If a patient is conscious, the ideal position is sitting and neck flexed. And if patient is comatose, what is the ideal position? Supine and neck flexed. So first important point, what's the ideal position for insertion of Ryle's tube? In conscious patient, it is sitting position with neck flexed. Okay, and what about comatose patient? Supine with neck flexed. So if patient is comatose, the ideal position is supine with neck flexed. Okay, so this is the ideal position for insertion of Ryle's tube. Second, how to measure the required length of Ryle's tube? So how we are going to measure that, how much length is required? So here you can see the length is measured from nose to ear to xiphisternum. Nose to ear to xiphisternum. Okay, so what's the mnemonic? It's necks. Can you see? N, nose, ear, and this is xiphisternum. So this is the length of Ryle's tube which is required in the patient. So this is how we measure, and this question was also asked in AIIMS. So how to measure the required length of Ryle's tube from nose to ear to xiphisternum. If you see in this Ryle's tube, you can see that there is presence of shots. Can you see the balls? So these are shots, and here you can see there are markings. So in Ryle's tube there are markings. So what are the levels of markings? And these markings indicate, so see, there is first marking at 40 centimeter, and this marking indicates what? GE junction. So the 40 centimeter indicates GE junction. There is second marking at 50 centimeter, and this marking indicates body of stomach. Third marking is at 60 centimeter, and the fourth marking is at 65 centimeter. The marking at 60 centimeter, it indicates pylorus. So this is what? Pylorus. And 65 centimeter, this is for duodenum. So 40 centimeter, G junction, 50 body of stomach, 60 pylorus, and 65 duodenum. How to remember? Mnemonic is GBPD. It is GBPD. 40 centimeter G junction, 50 body, 60 pylorus, and 65 duodenum. What are the uses of Ryle's tube? So there are diagnostic indications and there are therapeutic indications. So see the uses. So first see the diagnostic indication. It is used for saline load test, and we discussed in which condition we perform this saline load test. It is performed for diagnosis of gastric outlet obstruction. So for diagnosis of gastric outlet obstruction, we perform saline load test. So Ryle's tube is used in that. To assess free and total acid, in which patients we are going to assess? In patients of peptic ulcer. So in patients of peptic ulcer, we are going to assess free and total acid. It is useful in the diagnosis of tracheoesophageal fistula, and it is used in Hollander's test. What is this Hollander's test? It is used to check the completion of vagotomy. So this is used to check, Hollander's test is used to check the completion of vagotomy. Clear? So these are the diagnostic indications. What are the therapeutic indications? You have seen in surgery, especially in surgery ward, that anybody who is having gastric outlet obstruction, small bowel obstruction, perforation, peritonitis, upper abdominal surgeries, or patients who are having variceal bleeding. In all these cases, Ryle's tube is used for proximal decompression. So it is used for proximal decompression. Second, it is used for the nutrition also. What kind of nutrition? Enteral nutrition. So what are the therapeutic indications? First, it is used for decompression. It is used for decompression. So in which conditions? Intestinal obstruction, in patients of gastric outlet obstruction, if patient is having upper GI bleed, or in the patient if upper abdominal surgery is performed. Why? Because in post-operative period patients are having ileus. So for proximal gastric decompression or for proximal decompression, we are using the Ryle's tube. And another use is nutrition. So you have seen that we are giving liquids via Ryle's tube. So this is for enteral nutrition. Enteral nutrition. So these are the diagnostic and therapeutic indications of Ryle's tube. So tell me, what's the name of this tube? It's relatively shorter as compared to Ryle's tube, but almost indications are same, and it is used in infants and children. Since it is used in infants and children, indications are almost same. So this is infant feeding tube. How to differentiate it from Ryle's tube? First, obviously, it is shorter. What are the other differences? Can you see? There is presence of metallic balls at the end. These are known as shots. And here you can see there are no shots. So in infant feeding tube, no shots. Second thing, in Ryle's tube, you can see that there are markings. On Ryle's tube, there are markings, but in infant feeding tube, there are no markings. So here, no shots in infant feeding tube, and there are no markings. There are no shots, no markings. What are the uses? The uses are similar to Ryle's tube. Name is infant feeding tube. So the uses are similar to Ryle's tube, but it is used in infants and children. It's used in infants and children. This is infant feeding tube. Now see this tube. What is the shape of this tube? The shape is like T. So what's the name of this tube? This is Kehr's T tube. And you must be knowing in which situations or conditions we are using Kehr's T tube when we perform the choledochotomy. After choledochotomy, we insert the T tube and we perform the repair over T tube. So what's the use of this Kehr's T tube? It is used after choledochotomy. Okay. So see how we perform the choledochotomy. Imagine this is the liver, this is the gallbladder, this is the bile duct, and this is the duodenum. So if you see the blood supply of bile duct, it is coaxial at 3 o'clock and 9 o'clock, and it is mainly from inferior direction. Can you see how much? 60%. So there is coaxial blood supply mainly from inferior direction. That's why if we have to perform choledochotomy, we have to go for longitudinal incision. Why? If you go for transverse incision, since there is coaxial blood supply, the blood supply is divided, and what happens? There is ischemia. Because of this ischemia, there is increased risk of stricture formation. So first important point, what kind of incision is given in choledochotomy? It is the longitudinal incision. So we give this longitudinal incision. After that, we have to insert the T tube, and after inserting the T tube, we are going to perform the repair. So this T tube acts as a stent and healing occurs over T tube. Generally, in emergency choledochotomy, we use the T tube. Example, you have seen patients of cholangitis. So after conservative management, if patient is not going to improve, we go for ERCP with stenting. If patient is not improved, we go for PTC with stone removal and stenting. If both of these are not available or failed, what we go for? We perform choledochotomy, we relieve the obstruction, put the T tube and perform the repair. On which day the T tube cholangiogram is done? On 7th to 10th day. In such patients, on 7th to 10th day, we perform the T tube cholangiogram, and if there is distal filling defect, we retain the T tube for 4 to 6 weeks, and by Burheen's technique, we remove the stone. Clear? So this is one of the indication. So in most of emergency bile duct surgery or choledochotomy, we use Kehr's T tube. See what's the name of this tube? This was asked many times in AIIMS and NEET. This is Sengstaken-Blakemore tube, in short known as SB tube. How to identify? See how many balloons are there. So there is gastric balloon and there is esophageal balloon. So how many balloon? 2. So it is double balloon tube. How many lumens? If you see, this is for gastric balloon port. So this port is for gastric balloon, and this red colored port is for esophageal balloon. Can you see there is a third port, and this is for aspiration channel. So this is gastric aspiration port. Can you see these openings? Yes. So these are gastric aspiration openings. Okay. So how many balloons? 2 balloons. How many lumens? 3 lumens. So this is double balloon triple lumen tube. What's the name? This is double balloon and triple lumen tube. So this is double balloon triple lumen tube known as Sengstaken-Blakemore tube. So you know in which patients we are using this Sengstaken-Blakemore tube. This is used for controlling the varicose bleeding. Suppose after medication the varicose bleeding is not controlled, so we are going to insert this tube, and it is used to work like a tamponade. So it is used to work for esophagogastric tamponade, right? Problem: the patients in whom there is varicose bleeding, the blood is going to collect into the stomach, so stomach is distended. Second, certain patients at the time of presentation are in the state of shock. 2 important points. Stomach is distended and the patient is in the state of shock. So if you are not very careful during insertion, what's the problem? There is aspiration. So question: most common complication of SB tube insertion It's aspiration. So what should be protected during insertion? Airway. Important point. So what's the most common complication during insertion? The most common complication during insertion, and that's aspiration. Clear? So what is protected? Airway should be protected at the time of insertion. First important question. Second, for inflation of balloon, which substance is used? We are going to use only air. Why? Because it is easy to inflate and deflate the balloon with air. Use of water saline contrast is contraindicated. Now see how we are going to use it. We have inserted it, and after inserting, we are going to inflate this gastric balloon with 50 ml of air, and after that we are going to pull it so that this gastric balloon is stuck at G junction. And when it's stuck at G junction, then we are sure that esophageal balloon is in the esophagus. After that, we are going to inflate this gastric balloon further with 250 ml of air. So there is 300 ml of air here in the gastric balloon, and then we start inflating the esophageal balloon. So in this image you can see, first we are going to inflate it with 50 ml of air. After that 250 ml of air. So total there is 300 ml of air in the gastric balloon. It is distended. We discussed that there is aspiration channel, so there are multiple openings. So whatever the content is there into stomach, that is aspirated via third port. So this is for gastric aspiration. We have to inflate this esophageal balloon, right? What is the pressure which esophageal balloon should exert on esophagus? So the maximum pressure exerted should be 35 to 40 mmHg. Maximum pressure exerted by the esophageal balloon should be 35 to 40 mmHg. Another question. Why? Beyond this pressure, perfusion stops. So there is ischemia followed by perforation. Another important point, every 12 hourly we have to deflate the balloon. Which balloon? Esophageal balloon. So another important point, we have to deflate the esophageal balloon every 12 hourly. So I'm repeating three questions. Total amount of air used to inflate the gastric balloon 300. Maximum air exerted by esophageal balloon 35 to 40 mmHg, and every 12 hourly we have to deflate the esophageal balloon. So what are the uses of Sengstaken-Blakemore tube? So it is used to control the varicose bleeding. It is used to control varicose bleeding when it's not controlled by medicines. Clear? So when varicose bleeding is not controlled by medicine alone, it is used to control varicose bleeding. Second, when we are transporting a patient to higher center, to control bleeding during transportation. So to control bleeding during transportation. Sengstaken-Blakemore tube is used. There are two similar tubes which are also asked frequently. One is Minnesota tube and the second is Linton necklace tube. So how it looks? So here you can see it is Minnesota tube. So just like Sengstaken-Blakemore tube, it is also used for esophagogastric tamponade therapy. What's the use? Just like Sengstaken-Blakemore tube, it is also used for esophagogastric tamponade therapy. Tamponade therapy means it is going to control the bleeding with compression or with pressure. What are the differences? First, see how many balloons are there. So there is gastric balloon and there is esophageal balloon. So there are two balloons. Now see the lumen. How many lumens are there? So here you can see this is 1, this is 2, this is 3 and this is 4. There are 4 lumen. So what is the additional lumen here? You can see there is a port for gastric balloon like Sengstaken-Blakemore tube. There is a port for esophageal balloon like Sengstaken-Blakemore tube, and there is a gastric aspiration port. This is additional. What here? There is esophageal aspiration port. It means if you insert this tube, you can perform the aspiration of gastric content and you can perform the aspiration of esophageal content. It means with the help of this Minnesota tube, aspiration below the balloon and above the balloon can be done. So that's why for esophagogastric tamponade therapy, this is preferred over Sengstecken-Blakemore tube. I'm repeating. Two balloons, gastric balloon, esophageal balloon. How many lumen? 4 lumen. One for gastric balloon, one for esophageal balloon, one for gastric aspiration, and one for esophageal aspiration. So we can perform the aspiration from stomach, we can perform the aspiration from esophagus. So aspiration can be done below the balloon, above the balloon. So that's why this one is preferred over Sengstecken-Blakemore tube for esophagogastric tamponade therapy. What's the name? Minnesota tube. And this was the question in INI CET 2020. Latest question. This was the image-based question in INI CET 2020. Now see, what's the name of this tube? This is Linton necklace tube. And here you can see that there is a single balloon, that's gastric balloon. So if there is single balloon, gastric balloon, so this is going to control the bleeding from stomach. So if the patient is having isolated gastric varices, we are using this tube, Linton necklace tube. How many lumens? So here you can see there is esophageal aspiration port, there is gastric aspiration port, and there is gastric balloon port. So one port is for balloon, second is for aspiration below the balloon, and third is for aspiration above the balloon. Clear? So one balloon and 3 lumen. How much air is used to inflate this gastric balloon? We use 400 to 700 ml. So how much air? We are using 400 to 700 ml of air for inflating the gastric balloon. And what's the use? Since it is only used in stomach, so it is used for treatment of bleeding gastric varices. So it is used for treatment of bleeding gastric varices. Okay, nowadays lots of image based questions are asked and the students are confused between these tubes. So let's have a comparison. So it is easy to identify. In Sengstecken-Blakemore tube there are 2 balloons, and how many lumens? There are 3 lumens. So there is double balloon, triple lumen. Clear? And you can see this is Minnesota tube. So how many balloons? There are 2 balloons. So there are 2 balloons, and what you can see, how many lumens? 1, 2, 3 and 4. So there are 4 lumen. So in Minnesota tube, 2 balloons, 4 lumens. And if you see this Linton necklace tube, there is a single balloon, and how many lumens? 3. So there is single balloon and 3 lumens. Clear? So easily on image you can differentiate these 3 tubes, and all of these 3 are used for tamponade therapy to control the varicose bleeding. These 2 for esophagogastric bleeding, and this is used only for gastric varicose bleeding. See, what's the name of this catheter? This is Foley's self-retaining balloon catheter, also known as Foley's catheter. So here you can see balloon, and this balloon is responsible for self-retaining behavior of this catheter. So this is Foley's self-retaining balloon catheter. In this you can see this is 2-way and this is 3-way Foley's catheter. In 2-way Foley's catheter you can see this is main channel. This one is main channel. And what's the use of this main channel? Main channel is for drainage of urine. So this main channel, it's for drainage of urine. Okay. And here you can see there is a small channel, the channel on which this color is there. So this is the small channel, and this channel is for the inflation of balloon. So here you can see the balloon, small channel, it's for the inflation of balloon. You can see this balloon. So main channel for drainage of urine, small channel for inflation of balloon. If you see this 3-way Foley's catheter, here you can see this is the main channel. This is the small channel for inflation of balloon, and you can see there is a third channel. So what's the use of this third channel? This is used for irrigation. So this third channel, it's used for irrigation. And if you have seen the patients of TURP, transurethral resection of prostate, since there is ongoing bleeding, so ongoing irrigation is going on. Sometimes there is post-operative bleeding, so to avoid occlusion of catheter, ongoing irrigation is going on. So with the help of this three-way catheter, we are performing the irrigation in TURP patients. So what's the material of Foley's catheter? It's made of latex. What is the advantage of this latex? Advantage of latex is that there is less irritation and less crust formation. So there is less crust formation. Okay. Now see the important points related to the balloon. How much is the capacity of this balloon? It is 5 to 50 ml. If you have inserted Foley's catheter in ward or in emergency, with how much saline we are going to inflate the balloon for self-retaining purpose? So we are generally using how much saline? 10 ml. So for self-retaining, important point, for self-retaining, generally how much saline we use or inflate the balloon, we are going to inflate the balloon with 10 ml saline. There is a second use of this balloon. What? It can be used for hemostatic compression effect. So what's that hemostatic compression effect? The patients in whom TURP is done, sometimes in the post-operative period there is bleeding from operative site. So what you do? You inflate this balloon with 30 to 50 ml saline. So we are going to inflate the balloon with 30 to 50 ml of saline. So it is having hemostatic compression effect. What else we do? We pull the catheter. So after inflating the balloon with 30 to 50 ml of saline, we pull the catheter and we are going to tape the catheter over the inner aspect of thigh. So another important property, that for hemostatic compression effect, we inflate the balloon with 30 to 50 ml of saline. We pull the catheter and tape it to the inner aspect of thigh. For the size of catheters and tubes, there are two systems which are used. One is French and one is Gauge. So you know that in French system, the size increases with increase in French, and in Gauge system, size decreases. So how to calculate? Suppose for some tube or catheter, French is given. How will you calculate the outer diameter? It's not inner, it's outer diameter. So see, outer diameter in mm for any catheter, outer diameter, you have to remember, outer diameter in mm is equal to French by 3. Now imagine if the size of catheter is 18 French. Okay, so what's the outer diameter? It is 6 mm. So outer diameter in mm is equal to size in French divided by 3. This is how we assess or calculate the outer diameter of catheter. See what are the various sizes of catheters available. So if we see for pediatric patients, what are the sizes of catheters which are available? So this is 4, 6, 8, 10. And the sizes which are larger than 10, these are used for adult patients. So if you see in adult patients, so for adults, what are the sizes which are used? So obviously 12, 14, 16 and 18. 12, 14, 16, 18 used for adults, and for pediatric patients we are using 4, 6, 8, 10 French. Out of 12, 14, 16, 18, which one is most commonly used for males and which one is most commonly used for females? So if you see this 16 number, this is most commonly used for males. And what's the color of 16 French Foley's catheter? It's orange. And for females we are using this 14 French. So for females we are using 14 French, and what's the color? It's green. Nowadays color coding of cannula, color coding of Foley's catheters is very hot topic, frequently asked names. For males we use 16 French catheter, that is of orange color, and for females we use 14 French Foley's catheter, that's of green color. So see the color coding of Foley's catheter. So if you see gray, what is the size? 10 French. So see the color, it's gray and the size is 10 French. White color, size is 12 French. Here you can see green, that is 14 French, most commonly used in females. Here you can see orange, 16 French, and this is most commonly used in males. This is red, can you see here? Red. And what is the size of red catheter? 18 French. Yellow is 20, violet is 22, and blue is 24 French. So how to remember? It's very easy. The mnemonic is gray, white, gory, Valentine, babe. Gray, white, gory, Valentine, babe. Okay, you have to start from 10 French. So gray is 10 French, white is 12 French, G, that's green, that's 14, O, that's orange, that's 16, R, that's red, 18, Y, that's yellow, 22, Valentine, V, that's violet, 22, and B, that's blue, 24. Easy to remember. Gray, white, gory, Valentine, babe. Gray 10 French, white 12, green 14, orange 16, red 18, yellow 20. Violet is 22 and babe blue is 24. These are the 4 catheters which are commonly asked. So for females, what's the size? 14 French, color green. For males, most commonly used orange, that's 16 French. You have to remember red. Red is of 18 French, and yellow is of 20 French. See the uses of Foley's catheter. Various uses of Foley's catheter. So you have seen in emergency that we use Foley's catheter to relieve urinary retention. In post-operative patient, critically ill patient, to measure urine output, or in OT also we insert Foley's catheter to measure urine output. If we have to give intravesical chemotherapy for CA bladder, we use Foley's catheter. Sometimes we discuss the 3-way catheter is used for irrigation. So in the patients of TURP, for irrigation we use 3-way Foley's catheter. It can be used for suprapubic cystostomy also. You have seen when we perform suprapubic cystostomy, we insert a special catheter. When this patient comes in follow-up, generally we remove the catheter and we insert the Foley's. So it can also be used for suprapubic cystostomy. So these are the various uses of Foley's catheter. These are Nilaton's catheter. And what's the use of Nilaton's catheter? These are used for one-time drainage of bladder, either during surgery or after surgery. So see, what are the uses? What are the uses of Nilaton's catheter? So generally it is used by anesthetist for emptying of bladder during or after surgery. So if they have to determine the amount of urine in bladder and if Foley's catheter is not in place, so we insert this Nilaton's catheter to determine how much urine is there in the bladder. So these are the uses of Nilaton's catheter. What's the name of this catheter? This was asked 2 to 3 times in names. This is Fogarty embolectomy catheter. It is having a balloon at the tip. So it is also known as Fogarty balloon catheter. What's the name? Fogarty embolectomy catheter. It is also known as Fogarty balloon catheter. How to identify? Can you see? It's a hollow tube. Can you see? It's hollow tube, and the identifying feature is what? That there is a balloon at the tip. So here you can see there is a balloon at the tip. So the name of this catheter is Fogarty embolectomy catheter. It means it is used for embolectomy. So in any vessel, if there is freshly formed embolus, we insert the catheter. Beyond that embolus, inflate the balloon and we take out that embolus. How it's used? Have a look. So in this picture you can see that this is the embolus. We are going to insert the catheter through the embolus. Beyond this embolus, you can see this is the balloon. We inflate the balloon and then we pull the catheter. So what you can see that we are going to remove the thrombus or embolus. So this is how we use Fogarty embolectomy catheter, and it is used to remove freshly formed embolus in the vessel. You have seen this catheter frequently used in surgery. What's the name? This is Mallicott's catheter. How to identify? Can you see? There is presence of umbrella or flower at the tip. Here you can see umbrella or flower at the tip. So because of this umbrella or flower at the tip, it is self-retaining. So first, this Mallicott's catheter, it's self-retaining. And how we are going to identify? Yes, this catheter is having this umbrella or flower at the tip. So what are the uses? Suppose Foley's catheter is not available, so it is used for drainage of urine also. If some drain is not available, even intercostal drain is not available, you can insert this. If there is percutaneous nephrostomy and we have to drain urine, we can use it. For intraperitoneal collection, we can use this Mallicott's catheter. So see what are the various uses. So Mallicott's catheter is used for drainage of urine from the bladder, drainage of urine from percutaneous nephrostomy. Okay. If there is some intraperitoneal collection, it can be used for drainage, and if chest tube is not available, it can be used as intercostal drain. So these are the various uses of Mallicott's catheter. How to identify? There is presence of umbrella or flower at the tip. What's the name of this catheter? See the color, it's red. This is a red rubber catheter. How to identify? Can you see this tip? This tip is rounded and blunt. What kind of tip? There is rounded and blunt tip. So see, there is rounded and blunt tip. You can see that there is no balloon. It means this catheter is non-self-retaining. And what is the use of this catheter? It is used for drainage of urine. So this is non-self-retaining urinary catheter. So this is first important point. It is non-self-retaining, and since it is used for drainage of urine, so this is non-self-retaining urinary catheter. So what are the uses? So it's non-self-retaining, that's why it is temporarily used to drain urine from the bladder. Why? Whenever we want to estimate the residual urine, so we use the red rubber catheter. So what are the names of these catheters you have seen? Frequently used in anesthesia, medicine and surgery. These are central venous catheters. And you have seen that via these central venous catheters we are giving fluid, blood, nutrition or medication. How we are going to use it and what are the preferred vessels? If a question is asked, what's the preferred vein for central venous catheterization? Preferred vein, what's the preferred vein for central venous catheterization? Frequently asked question, and that is what? Subclavian vein, followed by internal jugular vein, followed by femoral vein. So it is subclavian vein followed by internal jugular vein followed by femoral vein. Now see the language of question. Preferred vein for central venous catheterization inside OT. So inside OT, which one is preferred? It is the internal jugular vein. Outside OT, which one is preferred? It is subclavian vein. And third, in acutely injured, critically ill patient, which one is preferred? Femoral. So three important questions. Preferred vein for central venous catheterization inside OT, outside OT, and acutely injured, critically ill patient. So inside OT, which one is preferred? It is internal jugular vein. Outside OT, which one is preferred? Overall, which one is preferred? Subclavian vein. And if it's urgent, acutely injured, critically ill patient, so we use which one? Femoral. So these are the questions related to veins. How we insert it? Where is the tip of this catheter? So in this picture you can see that the tip of catheter is located in superior vena cava. So here you can see that the tip is located in superior vena cava, and overall most commonly preferred vein is what? This is subclavian vein. So this subclavian vein is most commonly preferred. Now there are two questions related to complications. First, what's the most common complication of central venous catheterization? And if it's there for long duration, there is catheter related sepsis. This was asked many times. Catheter related sepsis. So most common complication of central venous catheterization, catheter related sepsis. And sometimes you have seen when anesthetist is inserting this central venous catheter, patient is going to develop pneumothorax. Why? There is injury of apex of lung. So just after insertion, we send the patient for chest x-ray. So what's the most dangerous complication of central venous catheterization? And it's the pneumothorax. Most dangerous complication, and that's the pneumothorax. Cannulas, color coding, their sizes. These are frequently asked in AIIMS and NEET PG. So see first the sizes. Orange cannula, it is having 14 gauge. The size is 14 gauge. Gray 16, green is 18, pink is 20, blue is 22, yellow is 24, and violet is 26. This is the color coding. Now see what is the flow rate of various cannulas and what are the indications. So what's the size of orange? It is 14 gauge. How much is the flow rate? It's maximum. This flow rate is asked nowadays. So this is 240 ml per minute. The flow rate is 240 ml per minute. The gray cannula, what's the size? It is 16 gauge. And how much is the flow? This is 180 ml per minute. Okay. Both of these are having similar indications. So generally we are using orange and gray cannula in trauma and surgical procedures. So where we are going to use? These are used in trauma and surgical procedures. Orange and gray. Now see green. What's the size? 18 gauge. And how much is the flow rate? Just half of gray, and that's 90 ml per minute. So what's the use of green cannula? It's used for trauma patients and for quick blood transfusion. So it is used in trauma patients and it's used for quick BT, quick blood transfusion. What's the size of pink cannula? It's 20 gauge. How much is the flow rate here? It's 60 ml per minute. And you have seen that it is frequently used in adult patient in medicine ward. So what's the use? It's used for IV fluids and this is also used for blood transfusion. Pink cannula, flow rate 60 ml per minute, used for IV fluid administration and blood transfusion. Blue, the size is 22 gauge and how much is the flow rate? 36 ml per minute. And generally you have noticed that this blue cannula is used in children and older adults. So what's the use? It's used in children. So you have seen use in the pediatrics ward and older adults who have friable veins. The size of yellow cannula is 24 gauge. And how much is the flow rate here? The flow rate is 20 ml per minute. And this is also used frequently in the pediatrics ward. So this is used for neonates. It's used for children and elderly. Yellow, it's used for neonates, children and elderly. And what's the size of this violet? Violet is of 26 gauge. How much is the flow rate here? It's 13 ml per minute. So the flow rate is 13 ml per minute and this is used for neonates. Right? So these are important points. What are the set of questions which are asked? First set is on the basis of color coding, they ask you the gaze. And second, on the basis of color coding, they ask you what's the flow rate. Clear? And what are the uses of cannula. So it's very, very important. Color coding of cannula and color coding of Foley's catheter, specially asked in AIIMS. So how to remember the sizes of cannula according to the color? So see, mnemonic is organized green, pink, violet. So OR, this is orange. And what was the size? 14 gauge. G, that's gray. What was the size? 16. For green, it's 18. For pink, it's 20. B means blue. And blue is 22. Y, that's yellow. 24. Violet, that's 26. So the mnemonic is organize green, pink, violet. Orange 14, gray 16, green 18, pink 20, blue 22, yellow 24 and violet 26. So this is how we can easily remember the color coding of cannula and their sizes. This was an image-based question in AIMS and it was asked for the first time. What's the name of this catheter? This is chemoport. So what is this? This is totally implantable venous access device. Chemoport, it is totally implantable. Totally implantable venous access device. Okay, so where we are going to implant this chemoport? Obviously in a vein. What is the preferred vein? Two veins which are commonly used. One is internal jugular vein and the second is subclavian vein. So for chemoport, internal jugular vein and subclavian vein is frequently used. Now what's the name? The name is chemoport, right? So the name is chemoport, so the term is self-explanatory. There is port for chemotherapy. So chemoports are used for chemotherapy administration. So the patients who require chemotherapy, generally we are going to insert the chemoport and it is used for 1 to 2 years. So what's the use? This is for chemotherapy administration. Name is chemoport, so it is for chemotherapy administration. And generally for how long it is there or for how long it is retained, we are going to retain it for 1 to 2 years. Clear? So the patients who are going to require chemotherapy for longer duration, chemoport is used. So in this patient you can see that this chemoport is inserted into which vein? See here, this is subclavian vein. So in subclavian vein this chemoport is inserted. See what are the parts. So if you see this chemoport, there are palpation bumps. So with which you can feel there is presence of septum and there is a power port. Clear? And there is power lock. So whatever the needle which is attached, it is attached here. Here you can see the catheter placed beneath skin and this is inserted into a blood vessel. So via this chemoport, we are going for chemotherapy administration and generally it is retained for 1 to 2 years. What are the complications? So the complications associated with insertion and retention are catheter embolism. Sometimes there is occlusion of chemoport, that's known as port occlusion. So the vessel in which it is inserted, there is vascular thrombosis. So the complications are catheter embolism, port occlusion and vascular thrombosis. So this is all about catheters, tubes and drains. Now we are going to discuss the instruments. Instruments are very, very important because every year there is one question in NEET PG and AIMS PG from instruments. And second, it is very important for final year students. Why? Because there is a separate instrument viva in final year exam. Sometimes in spotting also you will find 1 or 2 surgical instruments. So first see what are the parts of the instrument. See, this is a needle holder. What are the parts you can see? This is the tip. This working end is known as blade. And if you see the inner aspect of blade, there is presence of serrations and certain instruments, as you see here, there is Ellis tissue forceps end or blade that is having prongs, that's known as teeth. Clear? Now this is the joint, or it's also known as box lock. This part is known as shaft or shank. And here you can see there is ratchet or catch. So this is the interlocking part of instrument. And you can see these are the finger bows. Can you see? Finger bows are going to control the jaw movement of the instrument. So see the important points here. In the blade, there is presence of serrations. And sometimes you will notice that there are prongs. And these prongs are known as teeth. So this is for firm grasping of the tissue. So you know in which instrument these kind of teeth is there. So this is the blade of Ellis tissue forceps. Ellis tissue forceps. Clear? Now see the types of serrations which are present in the jaw. So what kind of serrations are present? Here you can see there are 3 types of serrations. Clear? So first, if you see this one, here you can notice that these are transverse serrations. And in which instrument transverse serrations are present? These are seen in artery forceps. So transverse serrations, these are present in artery forceps. Clear? So on the basis of serrations, you can find out the instrument, identify the instrument. Here you can see there is longitudinal serrations, and in which instruments there is presence of longitudinal serrations in the jaw. It is present in the clamp. So intestinal clamp. So longitudinal serrations, these are present in intestinal clamp. Okay, and here you can see cross-hatched serrations. Can you see the orientation? It's like this. Cross-hatched means it's like this. So these are cross-hatched serrations, and these are typically present in which instrument? Needle holder. So cross-hatched serrations, these are present in needle holder. Clear? Second important point, on the basis of serrations and on the basis of tooth, you are going to identify whether the instrument is traumatic or non-traumatic. So here you can see two instruments. You can see here that there is fine serrations, presence of fine serrations, okay, in the jaw or blade, and here you can notice that there is presence of a tooth, okay. So if any instrument is having deep serrations or there is presence of tooth, this instrument is having penetrating effect or crushing effect. So presence of tooth or deep serrations, it suggests that the instrument is traumatic, okay. So important point, in non-traumatic forceps, there is presence of fine serrations, and in traumatic forceps, either there is presence of deep serrations, so deep serrations are present, or there is presence of tooth, and because of these deep serrations or tooth, there is crushing effect or penetrating effect. Now what is the name of this instrument? This is a type of towel clip. How to identify the towel clip? Here you can see that there is curved blade. So towel clip is having curved blade, and you can see there is pointed tip. Curved blade and pointed tip. So the name is towel clip. So it is used to fix the towels or drapes. So what is draping? You have seen in surgery OT that first we had to clean the patient, and after cleaning the patient, we have to isolate the surgical field. This isolation of surgical field with the help of towels is known as what? Draping. So how we do? You have noticed that we are going to use towels like this, and we are going to isolate this surgical field. So how we are performing the draping? We are going to perform the draping with the help of these towel clips. So towel clips are applied here. Second, you have noticed that nursing sister is also using the towel clip for fixing cables, suction tubes, catheters, diathermy cables to the sheet. So what's the use of towel clip? It's towel clip. So it is used to fix towels or drapes. So it is used to fix towels or drapes. Second, it is used to fix suction tubes, catheters, diathermy cables, laparoscopic wires, and so on to the sheet. Clear? There are three types of towel clips which we use. How to identify? Have a look. Now first see the names. This is Mayo's towel clip. Okay. And second is having pinch cock action. This is Doyen's towel clip. What's the name? This is Doyen's towel clip. And if you see this towel clip, in each blade you will notice that there are two teeth. Can you see? Presence of two teeth. So there is presence of two teeth in each blade. So what's the name? Moynihan's tetra towel clip. So the name of this instrument, this is Moynihan's tetra towel clip. Why? Because there are total 4 teeth, 2 teeth in each blade. Okay. How to identify? First see how to identify Mayo's and Doyen's. If you see, in Mayo's there is a catch or ratchet. So you can see here, there is presence of catch or ratchet in Mayos, but in Doyne's towel clip, there is pinch cock action. Can you see? You press it like this and it's going to open. So there is pinch cock action in Doyne's, right? In each blade, there is a single tooth. But in Moynihan's tetra towel clip, you will notice that there is presence of 2 teeth in each blade. So easily you can differentiate these 3 instruments. Apart from fixing of drapes, fixing of dithermy cables, tubes, suctions and catheters, there is another use of Moynihan's tetra towel clip. So what's the another use? Moynihan's tetra towel clip, it is used to hold the cut edges of skin to the 4 corners of the draped towels. So these are the uses of towel clips. Now see, what's the name of this instrument? This is Ramplay's sponge holding forceps. How to identify? You can see there is oval tip, and in the tip, what happens? In the blade, you will notice that there is presence of serrations over the inner aspect. Why? The name of instrument is Ramplay's sponge holding forceps. So obviously it is used to hold what? Sponge. So with the help of these serrations, what? There is firm grip on the sponge. Second thing you can notice that there is presence of fenestration. So from this fenestration, if you are going to hold the gauze or swab, the gauze or swab is going to bulge out via the fenestration. If you notice, this instrument is having long blade and long shaft. Have you seen the use in OT? So here the scrub surgeon is using this instrument for cleaning. So since the instrument is having long blade and long shaft, the scrub surgeon avoid touching the rest of areas during cleaning. Clear? So this is Ramplay's sponge holding forceps. Now see what are the uses of Ramplay's sponge holding forceps. So the name is sponge holding forceps. So it is going to hold the sponge and it is used for cleaning. Second, you have noticed that it is also used in open cholecystectomy. So how we use it? You have noticed that we are going to hold the fundus and sometimes Hartmann's pouch with this instrument. So what's the use? We hold fundus and Hartmann's pouch. Okay, in open cholecystectomy. It is sponge holding forceps. So we are going to hold the sponge or swab and we are going to swab an abscess cavity. So another use, it is used to swab an abscess cavity. And in patients who are having hydatid cyst, in hydatid cyst surgery, with the help of this instrument, we are going to remove the laminated membrane and daughter cyst. So in hydatid surgery, it is used for removal of laminated membrane and daughter cyst. Clear? So these are the uses of Ramplay's sponge holding forceps. What's the name of this instrument? This is Bard Parker's handle, and in short it's known as BP handle. If you see this instrument, in the handle there is presence of transverse serrations. Can you see? So here you can notice that there is presence of transverse serrations. This is for better grip. In this instrument there is slot for blade. So at this slot we are going to fix the blade. So here you can see this is the slot for blade, and in this image you can see how we are going to fix the blade in this slot. In NEET PG, there were questions related to number of blades used and their uses. So these are the commonly used blades, number 10, 11, 15, 22, 23. In exam, they are asking that what is the typical use or characteristic use of this particular blade. So if you see the blade number 10, this is used for skin incision. So we have to open the skin with the help of this blade. So number 10, it is used to open the skin. So used for skin incision. This was the blade which was asked in NEET PG. This was an image based question. So this is 11 number blade and this is used for arteriotomy. Can you see the tip is pointed? So it is used for incision and drainage also. So what's the use of number 11? This was the question in NEET PG. It is used for arteriotomy and it is also used in incision and drainage. This was the image based question in NEET PG. This is 15 number blade, and the 15 number blade you have seen we are using this blade in minor OT for minor surgical procedure. It is also used in plastic surgery and pediatric surgery. So number 15, it is used for minor surgical procedure and it's used in pediatric surgery and plastic surgery. Pediatric and plastic surgery. Now see, this is 22. 22 is used for abdominal incision, and if the skin is very thick we use 23 number. So 22, it is used for abdominal incision, and 23, it is used for very thick skin if the patient is having very thick skin. Okay, so you have to remember the number of blade and their uses. Remember the shape also, because in exam the number is not there. They will just give the blade image and they will ask you what's the use of this blade. Now see the various positions of holding a BP handle. So first, this is the dinner knife position, and you have seen in OT that this dinner knife position, it is used to make an incision and it minimizes tailing at the end. So what is this? This is dinner knife position. Then there is writing position. So for better handling of knife, this writing position is used. And if you have seen amputation, this kind of grasping position. So we are going to hold the BP handle in grasping position for amputation. So dinner knife position for making an incision, it minimizes tailing at the end. For better handling, this is the writing position, and the grasping position, this is used in the amputation. Now see what's the name of this instrument. This is needle holder or needle holder forceps. How to identify? You can identify this instrument on the basis of cross-hatched serrations. Can you see? So these kind of serrations are there. Cross-hatched serrations. Why there is presence of cross-hatched serrations? For better grip of needle. The name is needle holder. So there is cross-hatched serrations for better grip of needle. Second thing, you can notice here that there is central groove. So why there is central groove? So that there should be minimal crushing effect of the instrument on the needle, and there should not be straightening of a curved needle. So there is central groove so that there is minimal crushing effect on the needle. There is minimal crushing effect, okay, and there is no straightening of the curved needle because of this central groove. Now see the parts. This is the blade and this is the handle. And if you are going to notice this instrument, the blade is short, relatively short, and this handle is relatively long. So how much is the ratio of handle to blade? So handle to blade ratio is 4:1. So very important point which is asked in exam, the handle to blade ratio in needle holder. This is 4:1. In exam, sometimes examiner is going to ask you that how will you hold needle with the needle holder. So first see what are the parts of needle. This is pointed end or point. This is the swaged end where suture is attached to the needle. Clear? Now we are going to hold the needle at the junction of anterior 2/3 and posterior 1/3, or at the junction of 2/3 from the pointed end and 1/3 from the swaged end. So here you can see this is the needle, this is the swaged end. So I'm going to hold it at the junction of anterior 2/3 and posterior 1/3. So this is how we are going to hold the needle with needle holder. So what's the use of needle holder? So obviously suturing of tissues and sometimes during ligation. So the uses of needle holder, it is used in suturing and it is used in ligation. So these are the uses of needle holder. What you have to remember, handle to blade ratio 4:1, and where exactly you are going to hold the needle at the junction of anterior 2/3 and posterior 1/3. What is the name of this instrument? This is known as Doyne's rib respiratory. So it is used for ribs. Other name, it is also known as costal elevator. So this is also known as costal elevator. Doyne's rib respiratory or costal elevator. How to identify this instrument? You can see that there is polygonal handle. So for this better grip, there is polygonal handle. So this is for better grip. What is the use of this instrument? It is used to separate the periosteum from under surface of the rib. And that's why there is presence of curved ends with sharp edges. So here you can see there is curved end with sharp edges, and this is going to separate periosteum from the under surface of rib. So what's the use? It separates periosteum. What's the name? Costal elevator or rib respiratory. So it separates periosteum from under surface of rib. Okay, under surface of rib. So it's easy to remember, rib respiratory, also known as costal elevator. In the exam, examiner is going to ask you that tell me what is the side of this Doyne rib respiratory. So how will you determine the side? So for right side there is a separate instrument, and for left side there is a separate instrument. So how to identify? You have to put the instrument in such a way that its handle should face laterally. So can you see this handle? The handle should face laterally. And if you see this convexity should be upwards, right? And this is the tip, clear? And the tip should be downwards, clear? So handle should be lateral, the convexity should be upwards, and the tip should be downwards. So if you see, this is 1 and this is 2. So the first Doyne's rib respiratory, it is for right side, this is for right side, and the second Doyne's rib respiratory, this is for left side. Okay, so you can determine the side. Put the instrument like this so that the handle should face laterally, convexity upwards, and the end should be pointing downwards. Now see what's the name of this instrument. This is Cocker's thyroid dissector. Clear? The term is self-explanatory. So this is used in thyroid surgery for dissection. So it is used to dissect the superior thyroid pedicle in thyroid surgery. So what's the use of Cocker's thyroid dissector? It is used to dissect superior thyroid pedicle in thyroid surgery. So it is used to dissect the superior thyroid pedicle during thyroid surgery. What is the name of this instrument? This is aneurysm needle. And what is the use of aneurysm needle? You can see the various shapes. So what is the use of this aneurysm needle? It is used during venesection. You have seen in burns patients sometimes veins are not accessible, so we go for venesection or venous cut down. So we have to pass ligature around the vein. So for passing ligature around the vein, we are using aneurysm needle. So what's the use? It is used during venesection for passing ligature around the vein. Passing ligature around the vein. Name aneurysm needle and use in venesection. This instrument was asked many times in FMG, NEET, AIMS. What's the name? It's Humbee's knife. And what is the use of Humbee's knife? It is used for harvesting the skin graft. See here, you can calibrate the thickness of skin graft which is being harvested. So Humvee knife is used for harvesting both split thickness skin grafting and full thickness skin grafting. So what's the use of Humvee knife? It is used for harvesting skin graft and both types, split thickness skin grafting as well as full thickness skin grafting. Humvee's knife used for harvesting skin grafts. See these two instruments, these were asked many times in names. In this, which one is bone cutter and which one is rib cutter or rib shear? How to identify? If you see the first image, this is the visceral blade and you notice that it's blunt. Clear? Visceral blade is blunt. So it is placed under surface. And here this is parietal blade and this is sharp. So in rib cutter, only one end is sharp, another end is blunt. So this is visceral blade which is blunt and this is the sharp end. So the first image is rib shear, also known as rib cutter. This is rib shear or rib cutter. So obviously what's the use? It is used for cutting the ribs. And if you see the second image here, both blades are sharp, and since both blades are sharp, this is what? Bone cutter. Okay, bone cutter. So you can easily differentiate rib shear from bone cutter. In rib shear or rib cutter, only one blade is sharp, that's parietal blade. Visceral blade is blunt, whereas both blades of bone cutter are sharp. Now see what's the name of this instrument. This is Kelly's rectal speculum, also known as proctoscope. How to identify this instrument and what are the parts? So here you can see this is outer sheath. So here you can see outer sheath, and this is what? Handle. So here you can notice that this is handle. So there is outer sheath and there is handle in the outer sheath. Inside this outer sheath, this is the obturator which is used. And if you see the end of obturator, this is smooth and rounded. So there is smooth and rounded end of obturator, and in proctoscope there is outer sheath which is having handle. There are two questions which are frequently asked. First, related to uses of the proctoscope. First question is related to the uses and the second is related to length. So first see what are the various lengths which are frequently asked. What is the length of proctoscope? It is 10 centimeter. Rigid sigmoidoscope, it is 25 centimeter. Flexible sigmoidoscope, it is of 60 centimeter. And how much is the length of colonoscope? It is 160 centimeter. You have to remember. Now you can easily remember the indications. There are two kinds of uses. One is diagnostic uses and one is therapeutic uses. Okay. See the anatomy first. So if you see the length of surgical anal canal, that is of 3 centimeter. Length of surgical anal canal is of 3 centimeter. And how much is the length of rectum? It is of 14 centimeter. Length of rectum, that is 14 centimeter. Length of proctoscope is 10 centimeter. It means within 10 centimeter of anal verge, if some abnormality is there, you can detect it. So from anal verge within 10 centimeter, if there is some abnormality, you can detect it. If there is some abnormality, you can use it for therapeutic purposes also. So see what are the uses. First, diagnostic uses and therapeutic uses of proctoscope. First question, hemorrhoids are palpable or non-palpable? You have noticed that if the patient is having bleeding PR or lower GI bleeding, we perform digital rectal examination. So hemorrhoids are palpable on digital rectal examination or these are non-palpable. So hemorrhoids are non-palpable. That's why on digital rectal examination you cannot diagnose hemorrhoids. So what is the investigation of choice for diagnosis of hemorrhoids? It is proctoscopy. So first, for hemorrhoids, investigation of choice for diagnosis is proctoscopy. You visualize it and then you diagnose it. If within 10 centimeter there is rectal polyp, you can visualize. Rectal ulcer, you can visualize. You can diagnose carcinoma anal canal and the lower part of rectum. And We discussed fistula in ano. In fistula in ano, there is external opening. Sometimes it is difficult to localize internal opening on digital rectal examination. So we can localize internal opening on proctoscopy. What are the therapeutic uses? So you diagnosed hemorrhoid on proctoscopy, and we can perform sclerotherapy or banding with the help of proctoscopy. So sclerotherapy or banding can be done for hemorrhoids. Okay. Second, you diagnose rectal polyp if it is within 10 centimeter from the anal verge, and we can go for polypectomy. If you want to go for anal dilatation, we can go for anal dilatation with proctoscopy. So these are the uses of proctoscope. Now see, what is the name of this instrument? This is Farabaugh periosteal elevator. How to identify? You can see the parts. There is handle, thumb rest and blade. If you notice this thumb rest, this is corrugated, concave, and what kind of serrations are there? Transversely serrated. So this is corrugated, concave and transversely serrated. Why? For better grip. Okay, so we are going to hold this instrument like this. So thumb rest is corrugated, concave, transversely serrated for better grip. So the name is periosteal elevator. So it is going to elevate the periosteum. It means it is going to strip periosteum and muscular attachments from the bone. So name periosteal elevator. So what is the use? It is going to strip periosteum and muscular attachments from bone. Periosteum and muscular attachments from bone. So these are the uses of Farabaugh's periosteal elevator. What's the name of this instrument? So this is Mayo's vein stripper. You can see these are the caps, various sizes of caps used in Mayo's vein stripper. Name of this instrument is vein stripper. That's why it is used to strip the veins. Which kind of veins? Varicose vein. So what is the use of Mayo's vein stripper? It is used to strip varicose veins. Okay. How we are going to strip the varicose veins? Have a look. So imagine that this is a vein, clear? And I'm going to insert the stripper. I inserted the stripper. After inserting the stripper, I will take out the end and I'm going to apply what? The cap. I'm going to divide the vein, and after dividing the vein, I'm going to tie this vein over the stripper. And when I pull the stripper, what? The vein gets stripped. So in this image, you can see how we are going to strip the vein. Initially, varicose vein stripping was the treatment of choice. It was the part of Trendelenburg operation. It was the treatment of choice. But nowadays, what is the gold standard treatment for varicose vein? It's the endothermal ablation. Endothermal ablation is the gold standard treatment for varicose vein. Trendelenburg operation is not the treatment of choice. By the way, whenever we are performing the stripping, we have to take certain precautions. In cases of long saphenous vein, if the stripping is done, in cases of long saphenous vein, the stripping should be done just below the knee joint. So it should be done just below the knee joint to prevent the injury of which nerve? Saphenous nerve. In cases of short saphenous vein, we have to perform the stripping till ankle joint to prevent the injury of sural nerve. So see the questions. So in long saphenous vein, stripping should be done just below the knee joint. Just below knee joint. And in short saphenous vein, the stripping should be done till ankle joint. Why? So question which is asked directly or sometimes indirectly, that what is the most commonly injured nerve during stripping of long saphenous vein? And that's saphenous nerve. It's the saphenous nerve. And What is the nerve injured during stripping of short saphenous vein? And that is sural nerve. It's the sural nerve. What's the name of this instrument? You have seen this instrument being used in ortho and sometimes in surgery during amputation. So what is this? This is giggly saw. It is just like saw. You have seen certain carpenters using the saw for cutting the wood. So how we use it? Can you see there is stainless steel wire and these are the ends of wire, and you will notice that we are going to put the ends. So these ends are anchored to the hook of handle. So there are two handles and via hooks we are going to anchor these wires. Clear? One person is supporting the limb and another surgeon is performing the amputation by this kind of movement. So this is giggly saw, and this giggly saw is used for amputation. It is mainly used in ortho, sometimes in patients who are having diabetic foot. In surgery also we are using this for amputation. Now what is the name of this instrument? This is fistula probe. How to identify? In this instrument there is a longitudinal groove. What are the parts? You will notice that there is winged blade, there is curved shaft, and there is pointed tip. What is the name? Fistula probe. So it is used for probing and treating fistula in ano. Fistula probe. So it is used for probing and treating fistula in ano. Okay, fistula in ano. There is another use of this fistula probe, especially of which part of the instrument? Winged blade. You have seen certain kids which are having tongue tie. So what? This winged blade, it is used as a guide or protector to release the tongue tie. So another use, that this winged blade, it is used as guide and protector. Guide and protector to release tongue tie. Okay, so these are the uses of fistula probe. What is the name of this instrument? This is gallbladder trocar. You have noticed sometimes in lap cholecystectomy and open cholecystectomy that gallbladder is massively distended, and that's why it's very difficult to hold or catch the gallbladder with forceps. So for these cases, when the gallbladder is distended, we have to decompress the gallbladder by this pointed end of gallbladder trocar. So what's the use? It is used to decompress the distended gallbladder. Decompress the distended gallbladder during cholecystectomy. Now we are going to discuss forceps, and you know these forceps are two-bladed instruments. Two-bladed instrument, and it is used as pincher to hold, grasp, and to extract. So forceps are two-bladed instruments which are used as pincher to hold, grasp, and extract. One by one we are going to discuss the forceps. So first we are going to discuss Cocker's hemostatic forceps. How you can identify this forceps? It is very easy to identify. Like any artery forceps, what kind of serrations? There are transverse serrations. So here you can see the presence of transverse serrations in the blade. Second, in the Cocker's hemostatic forceps, what happens? There is presence of a tooth and groove. So there is presence of tooth and groove. So here you can see this is the tooth, and here you can see this is the groove. So this is Cocker's hemostatic forceps. Now see what are the uses of this Cocker's hemostatic forceps. So we discussed in appendectomy what's the use of Cocker's hemostatic forceps. So it is used to crush the base. So in appendectomy it is used to crush the base. Second, if you have seen mastectomy, there are perforating vessels which are bleeders. So it is going to catch the perforating vessels or bleeders. So it is going to hold the perforating vessels. In mastectomy, it's going to hold the perforating vessels. Okay. Another use, palms and soles are tough tissues. Palms and soles are tough tissues, and if there is a bleeder in the palm and sole, we are going to catch those bleeders with hemostatic forceps, and that's Cocker's forceps. So with the help of this Cocker's hemostatic forceps, we are going to catch the bleeder. Catch the bleeder in surgery of palm and sole, and you know these are tough tissues. And Cocker's hemostatic forceps are also used in thyroidectomy. So what are the uses? It is used in appendectomy to crush the base, mastectomy to hold the perforating or vessels or bleeders, in surgery of tough tissues like palms and sole to catch the bleeders, and it is used in thyroidectomy. What's the name of this instrument? This is mosquito hemostatic forceps. How to identify? It's light, small and delicate instrument, and can you see it is having fine pointed tip. What? Fine pointed tip. It's a type of artery forceps. That's why there is presence of transverse serrations in the blade. You have seen in OT, on the OT trolley, lots of these instruments are there. Mosquito hemostatic forceps. So this is having fine pointed tip, and if there is fine pointed tip, so it is going to control, it controls fine bleeding. It controls fine bleeding because there is fine pointed tip. Second, in appendectomy also we are going to use this instrument. So you notice that whenever we were performing appendectomy in mesoappendix at an avascular site, we are going to puncture the mesoappendix with the help of mosquito hemostatic forceps. So what are the uses? It controls fine bleeding, and in appendectomy it punctures mesoappendix. Punctures mesoappendix at an avascular site. At an avascular site. So these are the uses of mosquito hemostatic forceps. Now what is the name of this instrument? This is Spencer-Wells hemostatic forceps. So this is another type of artery forceps. We discussed that in artery forceps what kind of serrations are there. So here you can notice that there is presence of transverse serrations. 1 point. Second, you can see that this instrument is having conical tip. What kind of tip? Here you can see that there is conical tip. And if you see the blade and if you see the handle, so generally the blade is half of the length of handle. This is handle. So the blade is half of the length of handle. This is Spencer-Wells hemostatic forceps. So obviously it is used to control the bleeding, to hold the bleeding vessel. And second, in appendectomy, we use Spencer-Wells hemostatic forceps. So what is the use in appendectomy? In appendectomy, we are going to split the fibers of internal oblique and transversus abdominis with the help of Spencer-Wells hemostatic forceps. So what are the uses? So it is used to hold the bleeding vessel, and in appendectomy, it is used to split the muscle fibers of internal oblique and transversus abdominis. Now see this instrument, this is right angle forceps. What are the other names of right angle forceps? It's also known as Lahey's forceps, also known as mixture artery forceps. So first, it's a type of artery forceps. So what kind of serrations you can see? You can see that there is presence of transverse serrations. Second thing, the name is right angle forceps. So here you can see the terminal part of blade is at right angle to the rest of the blade. You can see here the terminal part of blade is at right angle to rest of the blade. So what is the advantage of this right angle forceps? This is the surgeon's friend. It can do some kind of dissection in the depth. Can you see like this? And it can catch the bleeder also in the depth. So this is right angle forceps, also known as Lahey's or mixture artery forceps. What are the uses? So the uses are, it is used to dissect pedicle of solid organs. Second, it is used to pass ligature around the vessel, and if some bleeder is there in the depth, it is going to catch that bleeder. You have seen that we are using right angle forceps in open cholecystectomy. So what's the use? You have seen that in open cholecystectomy, we are going to dissect the cystic artery and cystic duct. And second, with the help of this right angle forceps, we are going to pass the ligature to cystic duct and cystic artery. So in open cholecystectomy, what's the use? It is used to dissect and pass ligature. It is used to dissect and pass ligature to cystic duct and cystic artery. So these are the uses of right angle forceps, which is also known as Lahey's forceps, which is also known as mixture artery forceps. Sometimes in Viva, examiner is going to ask you, how will you differentiate this needle holder from the artery forceps? So first see, this is needle holder, and if you see the comparison, so if you see the blade of needle holder, it is relatively shorter, and if you see the handle, it is relatively longer. This is the artery forceps, this is the blade, and this is the handle. So one thing, that the blade is relatively shorter, handle is relatively longer in needle holder, and we discussed what is the ratio. Handle to blade ratio is 4:1. Now if you see the inside, there is presence of cross hatched serrations. What kind of? Cross hatched serrations. And there is presence of the central groove. Why central groove? Because it is going to prevent the straightening effect and crushing effect of the needle holder on the needle. So how to differentiate? First, you will notice that in needle holder there is cross hatched serrations and there is presence of central groove. The handle to blade ratio, it's 4:1. So blade is relatively shorter, handle is relatively longer. What kind of serrations are there in artery forceps? So you can notice it is transverse, and if you see the blade and handle, relatively it is longer. Blade is relatively longer in comparison to needle holder. So this is how you can easily differentiate needle holder from artery forceps. And sometimes questions are asked related to identification of various types of artery forceps. So we discussed three commonly used artery forceps. One is mosquito hemostatic forceps, second is Spencer-Wells, and third is Cocker's. Okay, how to differentiate? First, you can easily differentiate Cocker's hemostatic forceps because it is having a tooth and there is a groove. In rest of the two artery forceps, there is no tooth. So here there is presence of a tooth and there is presence of groove in hemostatic artery forceps. Clear? Now, how we are going to discuss mosquito from Spencer-Wells? We discussed that mosquito is small, delicate instrument with fine pointed tip. Can you see here? It's fine pointed tip used to control the fine bleeding. And if you see Spencer-Wells hemostatic forceps, here it's having conical tip. If you see the blade, this is the handle and this is the blade. Blade of Spencer-Wells hemostatic forceps is relatively longer. So what's the ratio? Here, handle to blade ratio, it's 2:1. Clear? So how to differentiate? Tooth and groove is present in hemostatic forceps. In mosquito, there is fine pointed tip, and in Spencer-Wells hemostatic forceps, there is conical tip. What's the name of this instrument? This is Ellis tissue forceps. How to identify this instrument? See, it is having curved or angulated tip. Can you see? It is curved or angulated tip, and in the tip you can notice that there is presence of alternate teeth and groove, and there is presence of alternate teeth and groove, and this is going to approximate. So this teeth and groove are going to approximate. So what is the advantage? That it is having firm grip and it prevents the slippage. So advantage of this alternate teeth and groove, that it is having firm grip and it prevents slippage of tissues. Okay. Second identifying feature, that it is having long straight blade, and if you see between these blades there is gap. Why there is gap? So that it is going to accommodate the tissues and there is no crushing effect of the instrument on the tissues. So what's the advantage? Since there is gap, in this gap it's going to accommodate the tissues or organ. Okay, and there is no crushing effect. So there is no crushing effect, right? But the problem, since it is having teeth and groove, okay, the tissues which are caught with the teeth and groove, in those tissues there is some kind of trauma, there is marks. So how to use these instrument, how to apply Ellis tissue forceps? It is applied over the inner aspect of the skin, so that there is no bite marks on the outer aspect. So we are going to hold the inner aspect of skin and subcutaneous tissue like this. So the inner aspect is caught with the teeth and groove of the Ellis tissue forceps. So we have to apply it over the inner aspect of skin and subcutaneous tissues. This instrument is commonly used in minor OT as well as in surgery OT, and it is commonly asked both in NEET and AIIMS. What are the uses? So you have seen the use in minor OT. It is going to hold the skin and subcutaneous tissue. So skin and subcutaneous tissue flaps are being held with Ellis tissue forceps for retraction in excision of lymph node, sebaceous cyst and lipoma. So it is used during excision of lymph node, sebaceous cyst and lipoma. And what's the use? To hold the skin and subcutaneous tissue flaps. It is going to hold the tough tissues. So what tough tissues? Like fascia and aponeurosis. So whenever we are going to approximate tough tissues like fascia and aponeurosis for suturing, this is used. So it is used for approximation of tough tissues like fascia and aponeurosis during suturing. Okay. During thyroidectomy and neck dissection also, for holding and lifting the skin flaps, it is used. It is used to hold the cut margins of skin. And what is the use in laparotomy? In laparotomy also, we are going to hold the cut margins of skin. And in bladder neck surgeries, it is going to hold the neck of bladder. So it holds the neck of bladder in bladder neck surgery. So these are the uses of Ellis tissue forceps. What's the name of this instrument? This is very, very important. It was asked many times in AIIMS and NEET. It is Babcock's tissue forceps, frequently used in general surgery. How to identify? Here you can see this terminal part is curved, and you can notice that there is fenestration. So terminal part is curved and there is fenestration. This is non-traumatic instrument. And when the instrument is closed, can you see there is space between the blades? So since there is space between the blades, it is going to accommodate the delicate structures. What are the delicate structures? Bladder, bowel, ureter, appendix. Clear? So how to identify? There is curved terminal part, there is fenestration in the blade, and there is space between blades, so that it is going to accommodate delicate structures. Delicate structures. And this is a non-traumatic instrument. So it is used in bladder, bowel surgeries frequently. See what are the uses. So what is the use in appendectomy? We discussed it is used to hold the appendix. So it is used to hold the appendix. It is used in gastrectomy. So whenever we are going to perform the gastrectomy, it is going to hold the cut margins of stomach. So what's the use? It is going to hold the cut margins. Okay. It is going to hold the tubular structures like ureter, like fallopian tube. In which surgeries generally it is going to use the ureter. So whenever we are performing pylolithotomy, ureterolithotomy, we use Babcock's tissue forceps. So it is used to hold ureter in pylolithotomy and ureterolithotomy. Pylolithotomy and ureterolithotomy. Whenever we are performing hernia surgeries, you have seen that it is going to hold the spermatic cord during hernia surgery. In resection and anastomosis, when we are going to resect the bowel, it is going to hold the cut margins. So it is going to hold the cut margins of small intestine, large intestine. Similarly, in suprapubic cystolithotomy, bladder surgery, suprapubic cystolithotomy, it is going to hold the cut margins of bladder. So bladder bowel related surgery In those cases, since the instrument is non-traumatic, it is used frequently to hold the cut margins. It is going to hold the tubular structures like ureter, fallopian tube and appendix. What's the name of this short, thick, bulkier and heavier instrument? It is short, thick, bulkier and heavier, and the name of this instrument is Lenz tissue forceps. How to identify this instrument? See, this instrument is having curved blade, can you see? And you can notice that there is fenestration. So it is having curved blade, there is fenestration. Another important point, if you notice here, there is presence of a tooth and there is groove. So what? Identifying features, there is curved blade, there is fenestration and there is presence of tooth and groove. This is short, thick, bulkier and heavier. So what is the use? It is short, thick, bulkier and heavier. So mainly it is going to hold or grasp the slippery tissue. Bulky and slippery tissue is being held by the Lenz tissue forceps. So see what are the uses? So it is used to hold the bulky and slippery tissue. In parotid gland and in submandibular gland surgery, what's the use? So this instrument is going to hold the gland. So it is going to hold the parotid gland. It is bulky and slippery submandibular gland. If you have seen the mastectomy, you know that the breast tissue is slippery, it is heavy and slippery. So it is going to hold that breast tissue whenever we are dissecting the breast tissue from underlying pectoral fascia. So these are the uses of Lenz tissue forceps. There are two kinds of dissecting forceps which are commonly used in general surgery. One is plain dissecting forceps and another is tooth dissecting forceps. The plain dissecting forceps, these are used in handling or holding of delicate structures like bladder, bowel, nerve, peritoneum. And the tooth dissecting forceps, it's mainly used whenever we are suturing the skin. Okay, so one by one we are going to discuss. First, see the plain dissecting forceps. In this, you can see that on shaft, on the outer side of shaft, there is presence of transverse ridges or serrations, so that you have a better grip over this instrument. Second, at the tip also you will notice that there is presence of transverse serrations, and if you notice the tip, it is fine olive shaped. So how to identify? There is presence of transverse ridges on the outer side of shaft for better grip of instrument, presence of transverse serrations over the tip, and what kind of tip is there? It is fine olive shaped. So see, what are the uses? It is used to handle or used to hold the delicate structures. So it is used to hold delicate structures. So it is going to hold peritoneum, nerve, vessel, muscle, bladder and bowel. So this is tooth dissecting forceps, easy to identify. Tooth dissecting forceps, so there is tooth and there is groove. Because of presence of tooth and groove, it is having better grip of the tissues. That's why there are lesser chances of slippage. So there is better grip because of this tooth and groove. There is better grip. There are less chances of slippage of the tissue. Second, you can see presence of transverse ridges or serrations on the outer side of shaft. So there is better grip of the instrument. Here you can see tooth and there is groove. See what are the uses of tooth dissecting forceps. So it is used to retract and hold. Used to retract and hold skin flaps. So during venesection or whenever we are performing the excision of sebaceous cyst, lipoma, lymph node, so it is used to retract and hold the skin flaps. Second, it is going to retract and hold tough tissues like skin, fascia aponeurosis. So it is used to retract and hold tough tissues like skin, fascia aponeurosis. What's the main use of tooth dissecting forceps? And the main use is suturing of skin incision. This is the main use. And if you remember the question which was asked in AIMS, that what are the three instruments required for suturing of the skin? So for suturing of skin, what is required apart from needle and suture? Needle holder. Second, to hold the skin, you need what? Tooth forceps, and to cut the sutures, what you need? Scissors. So for suturing, three instruments which are required are needle holder, tooth, forceps, and scissors. So see, what's the name of this instrument? This is Desjardins Choledocholithotomy forceps. Name is Desjardins Choledocholithotomy forceps. Let me tell you important points related to the instruments which are used in stone surgeries. First, that generally in these instruments there is no catch. Why? To prevent the crushing effect of the instrument when we are removing the stone. So no catch to prevent the crushing effect when we are removing the stone. Second, in these instruments there is curved shaft and curved blade. Why? So that we can work in the minimum space. This instrument can be used to work in the minimum space. And third, generally the instruments which are used for stones, they have fenestration so that they can accommodate the stone. So no catch to prevent crushing, curved shaft, curved blade, so that instrument can work in the minimum space, and there is fenestration to accommodate the stone. So what is the name of instrument? It is Desjardins Choledocholithotomy forceps. It means it is used to remove stone during choledocholithotomy, and sometimes it is used to remove stone in cholecystectomy. Okay, so what are the uses? It is choledocholithotomy forceps, so it is used to remove stone during choledocholithotomy and it is used to remove stone during cholecystectomy. So what's the name? This is Desjardins Choledocholithotomy forceps. It is very, very important. You have to remember. Now what's the name of this instrument? Again, this is one of the forceps used for stone. Which stone? Kidney stone. And the name of this instrument is Rendal's kidney stone forceps. So just like any other stone forceps, can you see there is no catch to prevent the crushing effect? You can see that there is fenestration to accommodate the stone, and you can see there is presence of transverse serrations at the end so that we have better grip of the stone. In this instrument, there is curved and angulated blade. Can you see here? And this angulation, there are many types of Rendal kidney stone forceps with various curvature and angulations. So why? So that you can work in the minimum space. So instrument can work in the minimum space. So this is Rendal's kidney stone forceps. So what is the use? It is used to grasp, mobilize and extract kidney stone. So it is used to grasp, mobilize and extract. Grasp, mobilize and extract kidney stone. What's the name of this instrument? This is suprapubic cystolithotomy forceps. So the name is cystolithotomy forceps. So this is used for suprapubic cystolithotomy to grasp the stone. Now how to identify this instrument? You can see that there is curved blade. Can you see? And if you notice, it is spoon shaped and concave. So blade is curved, spoon shaped, concave. Another very important and characteristic feature of this instrument, that there is presence of spicules for better grip. So you can see that there is presence of spicules in the blade. In the blade, there is presence of spicules. So what's the use? It is used for removal of stone during suprapubic cystolithotomy. So during suprapubic cystolithotomy, it is used for removal of stone. Name is suprapubic cystolithotomy forceps. You have seen this instrument in the dressing trolley, and generally this instrument is dipped in the yellow colored antiseptic solution. What's the name? This is Chittell's forceps. How to identify? See, In this instrument, you will notice that there is angulation and there is presence of large serrations in the blade. Over the inner aspect here, you will find that there is presence of large serrations, and these are having curved dipping blades. So this is Chittell's forceps. What is the use? You have seen that whenever we are giving some sterile object during dressing like gauze piece, some instrument, what we are using this. Second, in the OT also you have seen that whenever we are transferring some object from dressing trolley to the table or from tray to the table, so to avoid touching that sterile object, we are using Chittell's forceps. So what are the uses of Chittell's forceps? First, it is used to pick the sterile object. So it is used to pick the sterile object. And second, it is used to transfer objects or instrument from tray to table. So it is used to transfer objects or instruments from tray to table. Okay. So we avoid touching that object or instrument and we are transferring that object with the help of this Chittell's forceps. What's the name of this instrument? This is Lister's sinus forceps. How to identify this instrument? You can see that it is having straight blade, and if you see the tip, it is blunt, rounded and olive pointed. What kind of? It is, can you see here? It is blunt, rounded and olive pointed. You can make out, right? Simultaneously at the tip, you can notice that there is presence of transverse serrations. So it is having straight blade, blunt, rounded, olive pointed tip, and there is presence of transverse serrations at the tip. The name is Lister's sinus forceps. So since it is sinus forceps, so what is the use? It is used for exploring the sinus tract. So it is used to explore the sinus tract. Sinus tract. Second, very important use, and this was asked in exam also, that it is used in incision and drainage by Hilton's method. So incision and drainage of abscess by Hilton's method. What kind of abscess? The abscess which are located at the flexor aspect of body are the areas where neurovascular structure is superficial. Now imagine if some abscess is there in this cervical region or in neck region, if some abscess is there in axilla or in the groin. In these areas, the neurovascular bundle is superficial, and if we are going for stab incision, we might injure the neurovascular structure. So how we perform the incision and drainage by Hilton's method? You give the incision and then perform blunt dissection with the help of this Lister sinus forceps. So another use, it is used for incision and drainage of abscess by Hilton's method. By Hilton's method. And examiners are going to ask you how we perform incision and drainage by Hilton's method. So how we perform the drainage by Hilton's method? Here we give incision and then we perform the blunt dissection with the help of this Lister sinus forceps, especially in which areas where neurovascular bundle is superficial, like in the neck, in the axilla, in the groin, in popliteal region and over the flexor aspect. See, what's the name of this instrument? This is Duval's lung holding forceps. Duval's lung holding forceps. How to identify? You can see that this instrument is having straight blade. It's having straight blade. One thing. If you see the tip, here you can see it is broad and triangular. So blade is straight at the tip. It is broad and see the shape. It is triangular. You can see that there is presence of fenestration. Simultaneously over the inner aspect of the blade, especially at the tip, what you can see that there is presence of ridges and groove. So presence of ridges and groove at the tip, there is fenestration. Name of the instrument is Duval's lung holding forceps. So this is for holding the lung tissue. So it is going to grasp lung tissues during lobectomy and pneumonectomy. So what's the use of this dual slung holding forceps? It is going to or used to grasp lung tissues. Clear? During which surgery? During lobectomy and pneumonectomy. Lobectomy and pneumonectomy. Clear? So it is used during lobectomy and pneumonectomy to grasp the lung tissues. What's the name of this instrument? This is pile holding forceps. Pile holding forceps. How to identify? If you see, the blade is strong and curved. Can you see? Strong and curved blade. And second thing, there is presence of fenestration in the blade, especially at the tip. Name is pile holding forceps. So obviously, it is going to hold the pile mass. Obviously, during which surgery? Pile surgery. So it is going to hold, what's the use? It holds pile mass during piles surgery. So the name is pile holding forceps. Now see what's the name of this instrument. This is commonly used in gynecological surgery and this is ovum forceps. How to identify? It's very easy. You can see that there is spoon shaped tip and in the tip you will notice that there is presence of what? Can you see? Fenestrations. So there is spoon shaped tip and there is presence of fenestrations. It is mainly used in gynecological surgeries. So what is the use in surgery? You know that whenever we are performing laparoscopic cholecystectomy and sometimes the gallbladder is distended and there is presence of lots of stones. So we remove the stones from gallbladder with the help of this ovum forceps and it helps in extraction of gallbladder. So what are the uses? So it is used to remove the placental fragments and small endometrial polyps, generally in gynecological surgeries. And in cholecystectomy, what's the use? It is used for removing stones from gallbladder. Removing stones from gallbladder during extraction. So when we are extracting the gallbladder in lap cholecystectomy, we remove the stones from gallbladder with the help of this instrument. What's the name of this instrument? This is Yeoman's punch biopsy forceps. Yeoman's punch biopsy forceps. So it is used for punch biopsy. How to identify? If you see the tip here. So you can notice that there are two strong stout jaws. So there are two strong stout jaws so that we can take out the punch biopsy. Generally, it is used for taking punch biopsy from rectal lesions. So it is used for taking punch biopsy from rectal lesions like CA rectum, if there is carcinoma, if there is rectal polyp, or if there is rectal ulcer. Rectal ulcer. So identifying feature, there are two strong stout jaws so that you can take the punch biopsy. It is used for taking punch biopsy from rectal lesions like carcinoma, polyp and rectal ulcer. What's the name of this instrument? This is cord holding forceps. So it is used to hold the spermatic cord. Cord holding forceps. And it is used during which surgery? It is used during hernia surgery. So the name is hernia ring. What are the names? Cord holding forceps. So it is used to hold the cord or isolate the cord or retract the cord during which surgery? Hernia surgery. So another name, hernia ring. Identifying features. If you see the blades, you can notice that there is presence of semicircular blade. And if this blade is closed, you will notice that there is circular opening. So there is circular opening. Whenever we are performing hernia surgery, we are going to close the ring and we have to retract the cord away from the field. So whenever we are performing the dissection of sac, so whenever we want to perform the retraction of cord away from the surgical field, we use this instrument. So this is cord holding forceps. So what are the uses? It isolates cord structures from operative area during sac dissection and it retract cord away from the site of repair. So name is cord holding forceps, also known as hernia ring. Now we are going to discuss the retractors. So what are the uses of retractors? It is going to retract or it is going to hold open the edges of wound. Second, whenever we want to retract some organ or some tissue away from the working area of surgery, we use retractors. So what are the uses? So it is used to hold open the edges of wounds so that you can enter and perform the surgery. And second, it retracts or hold organs or tissue away from the working area of surgery. So one by one we are going to discuss the retractors. First, the most important retractor used in general surgery is Journey's retractor. Journey's retractor was asked many times in NEET and AIIMS in the form of image-based question. How to identify? It's very easy to identify. There are two blades. You can see on one side there is solid blade and on another side there is bi-flanged blade. Why bi-flanged? Because there are two prongs. At one end there are two prongs. If you see the tip of both bi-flanged blade as well as solid blade, you will notice that there is curved tip. Can you see this curvature? Can you see this curvature? So there is curvature inwards. So there is curved tip in both of the blades. Okay. So this tip is facing inwards. So what are the uses of this Journey's retractor? It is used in tissue retraction in appendectomy, hernia surgery, mastectomy and thyroidectomy. So see the uses. So what's the use of solid blade? This is the use of solid blade. So there is tissue retraction. We use this solid blade for tissue retraction in appendectomy, hernia repair, thyroidectomy, mastectomy. What is the use of this biflank blade? If you have seen laparotomy and whenever we are suturing the sheath, you have noticed that whenever we are suturing the end of incision, we are using this biflank blade. And here you can pass the needle. Can you see? Between the biflank blade, you can easily pass the needle. So what is the special use of this biflank blade? It retracts the end of incision. It retracts end of incision during suturing. Okay, so it retracts the end of incision during suturing of incision layer. So these are the uses of Journey's retractor. If you see this Langenbeck's retractor and if you see the blade here, it is very similar to Journey's retractor solid blade. So whatever the uses are there of solid blade of Journey's retractor, in those surgeries we can use the Langenbeck's retractor also. So this Langenbeck's retractor can be used for tissue retraction in appendectomy, hernia repair, thyroidectomy, mastectomy. So let's discuss the Langenbeck's retractor. So how to identify this Langenbeck's retractor? You can see there is serrated handle. So why there is serrated handle? So that there is better grip. In the handle, you can see there is fenestration. Why? The fenestration is there to make the instrument light. So to make the instrument light, there is fenestration. Here you can see the shaft. If you see the angle between blade and shaft, this is 90 degree. So blade is at right angle to shaft. And if you see this tip is also at 90 degree to the blade. So blade is at right angle to shaft and the tip is at right angle to the blade. We discussed what are the uses. So the uses are like solid blade of Journey's retractor. So we go for tissue retraction in hernia surgery, appendectomy, thyroidectomy and mastectomy. So the uses are similar to the uses of solid blade of Journey's retractor. This is Morris retractor. And if you see, there is some similarity between Morris retractor and Langenbeck's retractor. What? Here also, there is serrated handle for better grip of the handle. To make instrument light, there is fenestration. What are the differences? If you see, the blade, it's wider. And if you see, there is concavity in the blade. So if there is concavity, what? There is larger working area available for surgeon. And what? The curved tip is there. So there is more curvature, it is wider and there is concavity so that it is going to provide larger working space to the surgeon. So what are the uses of Morris retractor? It is used in tissue retraction in laparotomy and it retracts intra-abdominal viscus, especially what? Intestine and kidney. Intestine and kidney. And this was the image based question in NEET PG. This was an image-based question in NEET PG. So you have to remember the Morris retractor. This is another important retractor used both in general surgery as well as in gynecological operations. So if it is used in gynecological operations, obviously it is used for pelvic surgeries. Name is Doyne's retractor. If you see the blade here, there is more curvature as compared to Morris or as compared to Langenbeck's, and the tip is also more curved. So there is curved blade, curved tip, and if you see the handle, it is solid. This is solid. So generally it is used for pelvic surgeries. So in general surgery, what is the use? Generally it is used for LAR and APR. So for C rectum, it is used for LAR and APR. LAR means low anterior resection and APR means abdominoperineal resection. So when we are performing LAR or APR, this Doyne's retractor is going to retract what? Bladder. And if the female patient is there, it is going to retract bladder and uterus. So in these rectal surgeries for C rectum, it is going to retract, it retracts bladder and uterus. Clear? And it is used for gynecological surgeries also. This is Doyne's retractor. So see the comparison of these three retractors commonly asked in exam: Langenbeck's, Morris and Doyne's. How to identify? See, in Doyne's, the handle is solid, so there is no fenestration. So easily you can identify that in Doyne's there is no fenestration, there is solid handle. And what if you see the curvature in the blade and tip, it is more as compared to Langenbeck's and Morris. How to differentiate Langenbeck's and Morris? See the blade, see the width. So it is more wider and the curvature is more in Morris as compared to Langenbeck's. In Doyne's there is no fenestration. In Morris, the blade is wider, there is concavity and more curvature in comparison to Langenbeck's. So you can easily differentiate these three commonly used retractors. This is another commonly used retractor in pelvic surgery. What's the name? Kelly's retractor. How to identify? If you see, there is hollow grip handle and this is shaft, this is the blade. So blade is at right angle to the shaft. If you see, there is slightly bent tip, and if you see the shape of this lip, it is crescent shaped. So how to identify? Hollow grip handle, blade is at right angle to shaft, there is slightly bent tip and there is crescent shaped lip. Okay, what is the use? We discussed that it is also used in pelvic surgeries, especially for rectal dissection. So it is used in pelvic surgery for rectal dissection and the name is Kelly's retractor. This is one of the commonly used instrument in general surgery and the name is Dever's retractor. It's a big retractor. You have seen in instrument viva, sometimes the examiner is going to ask the student that choose one instrument and tell me the uses. If you are asked to choose one instrument, this is the perfect instrument. What? It's big instrument, so you have dominance also because instrument is in your hand. Clear? And there are multiple uses. So what are the uses of this instrument? How to identify this instrument? First, if you see the shape, it is like question mark sign. So you see the shape, it is like this. So it is like question mark sign. How to identify? You can see that there is flat curved blade and there is concavity. There is concavity. If you see the handle, so handle is very long and you will notice that there is hook at the end. So long handle with hook at the end, it provides firm grip. So it is going to provide firm grip. Okay, what are the uses? So it is going to retract the tissues and intra-abdominal organs in major surgeries. So see the uses. It is going to retract tissues and intra-abdominal organs in major surgeries. So if you have seen open cholecystectomy, we are going to retract the liver, we are going to retract the viscera, stomach. In hepatectomy, we are going to retract the liver. In gastrectomy and in other bowel surgeries, we are using this devious retractor. So for most of the major open intra-abdominal surgeries, we use this devious retractor. What's the name of this instrument? This is Farabaug's double-ended retractor. Why? Because both ends can be used and both ends are same. Okay, so Farabaug's double-ended retractor. How to identify? You can see that there is flat solid blade at each end, and you can see that there is curved tip. What are the uses of this Farabaug's double-ended retractor? So this Farabaug's double-ended retractor, it is used for tissue retraction in dentistry. If there is wrist or hand surgeries or hernia surgeries, in that also we use. So uses are for the tissue retraction in dentistry, wrist and hand surgeries and hernia surgery. Name is Farabaug's double-ended retractor. In this instrument, you can see that there is a single hook at the end. So what's the name? This is single hook retractor. So generally what's the use? This is used to lift the skin flaps and edges. So in which surgeries we are using this single hook retractor? See the uses. So it is going to lift the skin flaps or edges. If you have seen lymph node dissection, or in the minor OT if you have seen sebaceous cyst excision and lipoma. So whenever we are going to lift the skin flap and edges, we are using this single hook retractor. Sometimes in mastectomy and thyroidectomy also, when we are going to lift the skin flaps, okay, or retract the skin flaps, so in that also we are using this. So single hook retractor is used to lift the skin flaps and edges during lymph node excision of sebaceous cyst and lipoma, and during mastectomy and thyroidectomy it is used to retract the edges of skin flaps. In this instrument, you can see there is presence of two hooks at the end. So that's why what's the name? Double hook retractor. And what are the uses? The uses are similar to the single hook retractor. So see what's the name of this instrument? This is Volkmann's retractor. What is the other name of Volkmann's retractor? This is also known as cat's paw retractor. How to identify? You can see that at the end there is presence of multiple pointed sharp edges. And if there are multiple pointed sharp edges, it means it is helpful in firm retraction. So it is used for firm retraction of tough structures. So suppose I am going to retract the fascia in palms, in soles, in the scalp. So it is going to retract the tough structures like fascia in palms, soles and in the scalp. In lymph node excision, sebaceous cyst excision, lipoma excision, this instrument can be used. So what are the uses? It retracts tough structures, okay, like fascia in palm, soles and scalp, and like single hook and double hook retractor, it is also used in retraction of skin edges during excision of sebaceous cyst, lipoma and lymph nodes. What's the name of this instrument? This was asked previously in many exams. It is Joll's thyroid retractor, and this is self-retaining retractor. Self-retaining. How to identify? If you notice, it is having two towel clips like forceps. Can you see? It is like towel clip. So there are two towel clips like forceps, and you can see that there is a screw mechanism. This screw mechanism is going to adjust the jaw. So this is self-retaining. There are two towel clips like forceps at the end, and there is screw mechanism to adjust the jaw. How we are going to use it? See, whenever we are giving the skin incision during thyroidectomy and we have to raise the skin flaps, this instrument is used. One towel clip like forceps for upper and one for lower skin flap. So this is Joll's thyroid retractor. So what's the use? It is for retracting the skin flaps in thyroid surgery. So what's the use? It is hold and retract upper and lower skin flap during thyroid surgery, and Joll's thyroid retractor is a self-retaining instrument. This instrument is frequently used in ENT, and sometimes for intraoral surgeries we are using it in surgery also. So the name of this instrument is Doyne's mouth gag. Many times this was asked as an image based question in AIIMS and NEET. How to identify? If you see, there is presence of semicircular blade. So can you see? There is semicircular blade and there is curved tip. So it is applied for opening of mouth and it is used for intraoral surgeries. So what are the uses? So it is used to keep mouth open during glossectomy, if you are performing the surgery of cleft palate, if there is intraoral ranula, and sometimes when we are going to take biopsy, this Doyne's mouth gag is used. So these are the uses of Doyne's mouth gag. What's the name of this instrument? This is Balfour's self-retaining abdominal wall retractor. The name is Balfour's self-retaining abdominal wall retractor. How to identify this instrument? See, in this instrument, there is one horizontal bar. Can you see? So there is one horizontal bar. If you see, one blade is fixed. So at one end, there is a fixed blade at one end and there is a sliding blade. So this sliding blade is going to slide on this horizontal bar. So this is what? Sliding blade. So whenever we have to retract the cut edges of anterior abdominal wall, this sliding blade is used and it is going to retract the abdominal wall. If you see, there is a screw for third blade. In this horizontal bar, there is this screw for third blade. And if you see the shape of this third blade, the shape is like Doyne's retractor. And we discussed what is the use of Doyne's retractor. It is used for pelvic surgery. If we go only for abdominal surgeries, we use only these two blades. One is fixed and one is sliding. But if pelvic surgery is also being done, we are using the third blade. Okay. So this is Balfour's self-retaining abdominal wall retractor. The term is self-explanatory. Since it is abdominal wall retractor, it is used to retract the cut edges of anterior abdominal wall. So during gastrectomy, during hepatectomy, we are using this retractor. See the uses. So it is used to retract cut edges of anterior abdominal wall. Cut edges of anterior abdominal wall. In which surgeries? Generally in hepatectomy and gastrectomy. Hepatectomy and gastrectomy. What is the advantage of this instrument? That it is self-retaining. So if you have lesser number of people, lesser number of assistants, you can use this during hepatectomy and gastrectomy. And third blade, what's the use? Since it is like Doyne's retractor, so this third blade, it's used in pelvic surgeries. So imagine if a patient is having carcinoma rectum, we can use the third blade for APR and LAR. So third blade, it's used for pelvic surgeries. Generally LAR, low anterior resection, APR, abdominoperineal resection in carcinoma rectum. So these are the uses of Balfour's self-retaining abdominal wall retractor. This instrument was asked once in AIIMS. What's the name? This is Beckman-Wittlener's retractor. Generally, this retractor is used in ortho. How to identify? If you see, there are outward curving prongs. And when we are going to close the instrument, these outward curving prongs on closing, these are going to interdigitate. So these prongs are going to interdigitate. What are the uses of this Beckman's-Wittlener's retractor? So it is used to retract or hold back tissues or bone for exposure. So what's the use? It is used to retract or hold back tissues or bone for exposure. For exposure. Okay. So the name of this instrument is Beckman-Wittlener's retractor. What's the name of this instrument? This is scapula retractor. So what's the use? It is going to retract the scapula during which surgery? During thoracotomy. How to identify? See, this instrument is having wide right angled blade. Can you see this? Wide right angled blade, and in this blade you can see that there is presence of fenestration. See the handle of this instrument. It is long stout handle. So there is long stout handle, wide right angled blade with fenestration. So we are going to retract scapula during thoracotomy. So name is scapula retractor. So it is used to retract scapula during thoracotomy. Retract scapula during thoracotomy. This instrument is Ellison lung retractor. How to identify? This instrument is having long curved cylindrical handle. Can you see there is long curved cylindrical handle? And if you see the blades, these blades are made of wires in the form of net. Can you see? This is the blade, okay, and this blade is made of wires in the form of net. So the name is Ellison lung retractor. So generally it is used for retraction of the lungs. Whenever we are performing the surgery related to esophagus, in esophageal surgeries, we are using this instrument for retraction of esophagus also. So see the uses. So it is used for retraction of lungs, and since the blade is made of wires in the form of net, it prevents the damage of lungs during retraction. It prevents the damage of lungs during retraction. And in carcinoma esophagus, this instrument is used to retract the esophagus also. This instrument is bladder neck retractor. How to identify? You can see that there are two thin long blades. And if you see, there is presence of hook at the end. So here you can see two thin long blades and with presence of hook. What is the use? The term is self-explanatory. It is going to retract the bladder neck. So the use, it is used to retract the bladder neck. Obviously during which surgery? Bladder surgery. So what's the use? It retracts bladder neck during bladder surgery. So it retracts bladder neck. So name is bladder neck retractor, used for retraction of bladder neck. How to identify? Two thin long blades are there and there is hook at the end. So what are the clamps? Clamp presses two or more parts together to constrict or hold firmly. It presses two or more parts together to constrict or hold firmly. One by one we are going to discuss. First we are going to discuss the intestinal occlusion clamp. So there is Doyne's intestinal occlusion clamp and there is Pear's crushing clamp. What's the name of this instrument? This is Doyne's intestinal occlusion clamp. This is non-crushing. Okay, see the important points and how we identify this instrument. First, see, it's having flat, thin and springy blade. What kind of flat, thin and springy blade? We discussed that in clamp, what kind of serrations are there? So in clamp, there is presence of longitudinal serrations. So here also you can see that there is presence of longitudinal serrations. This is non-crushing. Okay, so what kind of serrations? Superficial. Longitudinal and superficial serrations. One feature. Second, if you notice it carefully, between the blades there is slight concavity and there is gap. So between the blades, if there is gap and we are going to clamp the intestine is going to bulge between the blades. Clear? So there is slight concavity and gap to allow bulging of bowel when we are going to clamp the intestine. Now what is the use? This is non-crushing. So we are using this instrument during resection and anastomosis. Why? To clamp the intestine. So whenever we are going to clamp the intestine, it prevents the spillage of intestinal content. So what's the use of Doyne's intestinal occlusion clamp? It clamps the intestine to prevent spillage of content. To prevent spillage of intestinal content. Okay, so it is used to clamp the intestine to prevent spillage of intestinal content. This is non-crushing. An important point, it is having superficial serrations. There is concavity and gap between the blades. What's the name of this instrument? This is Pear's crushing clamp. It is crushing clamp. It is a clamp. So what kind of serrations will be there? Longitudinal, you can see. And it is crushing. So here you can see there is presence of deep longitudinal serrations. It is a heavy instrument, and you can see there is stout handle. It works on double lever mechanism. So what's that double lever mechanism? See, this is the first lever here. So the first lever, it opposes the blade firmly, and there is second lever, it is going to multiply the exerted pressure. So it works on double lever mechanism. Double lever mechanism. Okay, first lever opposes the blade firmly, and the second lever multiplies exerted pressure. Another important point which was not there in Doyne's intestinal occlusion clamp. Here you can see that there is presence of tooth at end. So there is presence of tooth and groove at end. And if there is presence of tooth and groove, it is going to lock the blade fully. So it locks blade fully. So there is no slippage. It locks the blade fully. So the name is crushing clamp. Okay, so it crushes the bowel. So it is used in resection and anastomosis of bowel, and second, it is used in gastrectomy also. So what are the uses? So it is used in resection and anastomosis, RA, resection and anastomosis of bowel, and Pear's crushing clamp is also used in gastrectomy. Nowadays, vascular clamps are also asked. One is Light's bulldog clamp, one is Potts bulldog clamp, and third, which is frequently asked, that is Satinsky vascular clamp. So one by one, we are going to discuss the vascular clamps. First, see Light's bulldog clamp. It's a type of vascular clamp, Light's bulldog clamp. So it's a vascular clamp. It is used for temporary occlusion of small blood vessels. How to identify? See, in this instrument, there is pinch cock action. So if you press it, the instrument is going to open, and if you release the pressure, it is going to close. So what will happen? There is blood vessel, and if we are going to apply, it is going to cause the temporary occlusion of blood vessels. Now see the inner aspect of the instrument. There is presence of fine transverse serrations. Can you see here? Presence of fine transverse serrations. So what is the use of this Light's bulldog clamp? It is used for temporary occlusion of small blood vessels. Okay, so there is pinch cock action. This pinch cock action differentiates it from Potts bulldog clamp. So if you see this Potts bulldog clamp, here you can see that there is spring loaded handle. The serrations are similar to Light's bulldog clamp, and the use is also similar. It is also used for temporary occlusion of small blood vessels. So difference, here you can see that in Light's bulldog clamp, there is pinch cock action, and in this Potts bulldog clamp, there is spring loaded handle. So if you have seen a paper clip, it is looking like paper clip. So this is paper clip instrument used for temporary occlusion of small blood vessels. This is Satinsky vascular clamp. And what is the use of this Satinsky vascular clamp? This is used for partial occlusion of large blood vessels or its branches like inferior vena cava, superior vena cava, or aorta. How to identify this instrument? See, if you see, there are multiple angulations in this instrument. Can you see? Multiple angulations. And if we see the inner aspect of this instrument, can you see there is presence of vertical groove, and what? There is presence of fine transverse serrations. So there is vertical groove, fine transverse serrations, and multiple angulations. What is the use of this instrument? Partial occlusion. It is used for partial occlusion of large blood vessels like inferior vena cava, superior vena cava, and aorta. So partial occlusion of large blood vessels and its branches. Whenever we are using this Satinsky vascular clamp, when we are going to apply, so if you see, we are going to cause the partial occlusion of this larger blood vessel, and from rest of the lumen, blood flow is continued. So blood flow is maintained from the rest of lumen, and this is used for partial occlusion. So whenever some kind of tear is there, some kind of injury is there, with the use of this Satinsky vascular clamp, we can repair the site of tear or injury. So it's used for partial occlusion of large blood vessels and its branches. Name is Satinsky vascular clamp. Now we are going to discuss scissors. So you can see this is Mayo scissors. This is long and stout. And this Mayo scissors is used to cut the sutures. Apart from cutting suture, it is used for cutting the tough structures like sheath, aponeurosis, linea alba ligaments. So Mayo scissors, it is long and stout. And what are the uses? Uses of Mayo scissors. First, we use these scissors to cut sutures. So it is used to cut sutures. And second, it is used to cut tough structures. It is used to cut tough structures. So we use Mayo scissor to cut linea alba, aponeurosis, sheath and ligaments. This is Metzenbaum scissors. If you compare these scissors with Mayo scissors, you will find that this is lighter than Mayo's. Second thing, here you can see that there is long shaft and short blade. Long shaft, short blade, and it is lighter than Mayo's. This is used to cut delicate structures like bladder and bowel, and this scissors is used for fine dissection. Okay, so what's the name? Metzenbaum scissors. See the uses. So it is used for fine dissections. It is used for fine dissections, and it is used to cut delicate structures. So this scissors is used to cut delicate structures. So you have seen we use Metzenbaum scissors to open peritoneum, to dissect the sac from cord during hernia surgery. And whenever we are performing resection and anastomosis, this Metzenbaum scissors are used to cut the intestine. So name is Metzenbaum scissors, and it is used for fine dissections and to cut the delicate structures. What is the name of this scissors? There was an image-based questions in AIMS related to the scissors. So the name is Lister bandage scissors. So if the name is Lister bandage scissors, what's the use? So this scissors is used to cut the bandages. So how to identify this scissor? If you see the upper blade in this scissor, it is bent. And if you see the lower blade, it is flat, blunt. So lower blade, can you see this? This is flat and blunt. And if you see, there is presence of a non-traumatic tip. So there is bent upper blade and there is flat, blunt lower blade with non-traumatic tip. And this scissors are used to cut the bandages. In the OT you have seen. So what's the use of Lister bandage scissors? It is used to cut the bandages. So the term is self-explanatory. It is used to cut the bandages. See what's the name of this instrument? This is tracheal dilator. So what is the use of dilator? Dilator is going to enlarge any opening in progressive manner. What is dilator? Dilator is going to enlarge any opening in progressive manner. So this is tracheal dilator. So obviously this is used to dilate the trachea. Generally, in which surgeries we are using the tracheal dilator, the term is self-explanatory. It is used to dilate trachea in tracheostomy. And second, we are using this instrument whenever we are changing the tracheostomy tube. Now, trachea. To avoid the injury of mucosa of trachea, if you see in this instrument, there is olive pointed, blunt, smooth tip. What kind of tip you can see here? Olive pointed, blunt, smooth tip. Why? To avoid injury of tracheal mucosa. Injury of tracheal mucosa. Okay. So how to identify this instrument? There is olive pointed, blunt, smooth tip, and second important feature that there is gently curved blade. So what are the uses of tracheal dilator we discussed? So it is used during tracheostomy to dilate trachea. Used during tracheostomy to dilate trachea, and it helps in reinsertion of tracheostomy tube. So these are the uses of tracheal dilator. These are urethral dilators. So the name is urethral dilator. So obviously it is used to dilate the urethra. When we are going to dilate the urethra, when the patient is having stricture. So if patient is having stricture urethra, we can dilate the urethra in that situation. And second, before performing cystoscopy, we dilate the urethra with urethral dilators. So what's the use of this urethral dilator? It is used to dilate urethra. Dilate urethra. If patient is having stricture, or if we are planning to perform cystoscopy. So before cystoscopy. So these are the uses of urethral dilators. What's the name of this dilator? This is Bake's bile duct dilator. So here the term is self-explanatory that these dilators are used to dilate the bile duct. How to identify these dilators? If you see, you can see that in Bake's bile duct dilator there is narrow stem, and you see there is oval solid tip. Narrow stem, oval solid tip. So it is used to dilate the bile duct. So in which situations we are going to dilate the bile duct? See the uses. So what are the uses? In choledochotomy we have to dilate the bile duct after removal of stone. We have to perform sounding of bile duct, and we want to check whether there is any retained stone or not. And third, this instrument is used to check the patency of ampulla of Vater. So it is Bake's bile duct dilator. See this instrument, what's the name? If you have seen ice cream scoop, the end is like that. So the name is Volkmann scoop. How to identify this instrument? You see here, there is handle with serrations. So for better grip, there is presence of serrations in the handle. And if you see the end, here you can see that there is sharp-edged, curved and spoon-like trough. And this spoon-like trough, it helps in scooping or curettage. So see what are the uses of Volkmann scoop. So Volkmann scoop is used for debriding the contents of abscess cavity, sinus, fistula, and it is also used in collection of cancellous bone graft. So uses, it is used in debriding the contents of abscess cavity, sinus, fistula. Why? Because there is spoon-like trough, curved spoon-like trough. And the second use, it is used for the collection of cancellous bone graft. So the name of this instrument is Volkmann scoop, and it is used in scooping or curettage. This is another scoop, and if you see, the both ends are having spoon-shaped tip. Can you see? Both ends are having spoon-shaped tip. And what's the name? Name is gallstone scoop. So if the name is gallstone scoop, so it is used to scoop or remove the gallstone from the gallbladder. So what's the name? Here you can see that there is spoon-shaped tip. So what's the name? Name is gallstone scoop. So what's the use? It is used to remove gallstone from gallbladder. Remove gallstone from gallbladder. So generally during cholecystectomy, whenever it's difficult to extract the gallbladder, this scoop is used for removing the gallstone. Now we are going to discuss the laparoscopic instruments, and this is Wiere's needle. This needle was asked many times in AIIMS and NEET. So what is the use of this Wiere's needle? We already discussed that this needle is used to create pneumoperitoneum, and by which method it is used to create pneumoperitoneum? By closed method. Wiere's needle, it is used to create pneumoperitoneum, and by which method? That's known as closed method. There is another method of creating pneumoperitoneum, that is open method, in which we have to insert the Hussen's cannula for creating the pneumoperitoneum. By Wiere's needle, if pneumoperitoneum is created, it's known as closed method. This is closed method. Okay. How to identify this instrument? It's very, very easy. Here you can see that there is a sharp tipped needle, and you can see there is blunt tipped obturator. So in this, there is sharp tipped needle and blunt tipped obturator. Now see how it works. This sharp tipped needle is going to penetrate the abdominal wall, and when it is going to penetrate the abdominal wall, the resistance is lost. Resistance is lost. Okay, and when the resistance is lost, what happens? This blunt tipped obturator, it springs forward to prevent any iatrogenic injury. So sharp tipped needle penetrates the abdominal wall, resistance is lost, and then blunt tipped obturator springs forward to prevent any iatrogenic injury. Second important point related to Veery's needle, that how we check the intraperitoneal position of Veery's needle. Suppose you have to insert the Veery's needle, we have to check whether it is in the intraperitoneal cavity or not. So this is checked by saline drop test. How we do this saline drop test? Have a look. How we perform this saline drop test? We have to attach a syringe with saline to the Veery's needle. First we have to aspirate. After aspiration we have to remove the plunger. In the syringe still saline is there. After removing plunger, if there is free flow of saline, it suggests that the Veery's needle is in the intraperitoneal cavity. So Veery's needle is in the peritoneal cavity and it is checked by saline drop test. So see again how it's done. We have to attach a syringe with saline to Veery's needle. We aspirate. After that we have to remove the plunger of syringe and observe for free flow of saline into peritoneal cavity. If there is free flow of saline into peritoneal cavity, it suggests intraperitoneal location of Veery's needle. So it suggests intraperitoneal location of Veery's needle, and the name of this test, it is saline drop test. What's the name of this instrument? This is Hassan's cannula, and we discussed that it is also used to create pneumoperitoneum by which method? Open method. So it is used to create pneumoperitoneum by open method, Hassan cannula. So in which patients this Hassan cannula is used for creation of pneumoperitoneum? Imagine if the patient is having previously upper abdominal surgery. Because of this, there might be adhesions. Second, if the patient is having ileus and there is distended bowel loops, so in these patients, we create pneumoperitoneum by open method and we use Hassan cannula. So in which patients we are using? It is used in patients who are having, there is history of upper abdominal surgery, or if the patient is having ileus. What is the advantage of Hassan cannula over the Veery's needle for creating pneumoperitoneum? With Veery's needle, we might injure the blood vessels. But with Hassan cannula, since pneumoperitoneum is created under direct vision, there are lesser chances of vascular injury. So what's the advantage? Advantage that with this method, there are less chances of vascular injury. So there are less chances of vascular injury. Clear? So what's the name of this instrument? This is Hassan's cannula, used for creation of pneumoperitoneum by open method. What is the name of this instrument? This is trocar, another instrument used in laparoscopic surgery, and this was an image based question in AIIMS. See, in this trocar there is an obturator, and if you see this obturator, it is having pyramidal cutting tip. So this is having pyramidal cutting tip. Why? Because it is going to pierce the muscle and rectus sheath. So this pyramidal cutting tip of obturator, it pierces muscle and rectus sheath. Clear? So what's the use of this trocar? First, it is going to access the peritoneal cavity. And second, you have seen that it is going to maintain pneumoperitoneum when instruments are getting changed. So what are the uses of trocar? First, it is used to access peritoneal cavity. It is used to access peritoneal cavity. Okay. And second, it maintains pneumoperitoneum. maintains pneumoperitoneum when instruments are getting exchanged. So this is trocar. What's the name of this instrument used in laparoscopy? This is laparoscope. Laparoscope. First question which is asked related to this laparoscope, that it is based on which optical system? It is based on Hopkins optical system. First question. It is based on Hopkins optical system. Okay. Second, if you have seen laparoscopic surgery, why we use laparoscope? First, it is going to visualize the contents, peritoneal cavity. So it is used for visualization because it is attached to camera. And second, it helps in magnification. So what's the use? Laparoscope, it provides visualization and very important, magnification. Visualization and magnification. Clear? Now see what are the types. It is of two types. You can see here, see the end. This is oblique weaving. So if the angle is 30 degree, 45 degree, 60 degree, this is oblique weaving. And if the angle is 0 degree, it means it is flat. So this is end weaving. What are the types? It's of two types. First, end weaving. So in end weaving, the angle is 0 degree. And there is oblique weaving laparoscope. In oblique weaving, what are the angles? 30 degree, 45 degree, 60 degree. So which laparoscope is having larger field of vision? So the laparoscopes which are oblique weaving, those are having larger field of vision, and that's why oblique weaving laparoscopes are preferred. So which are preferred? Oblique weaving. Why? Because these are having larger field of vision. Okay. See, in this laparoscope, this is the place where we are going to attach the camera. So there is coupler, we have to attach the camera, and here we are going to attach the light source. So here you can see light source is attached here, and we are going to attach camera. So this is laparoscope. There are two types. One is end weaving and one is oblique weaving. Oblique weaving laparoscopes are preferred, and you have to remember it is based on Hopkins optical system. Now see other instruments which are used in laparoscopy. Commonly used instrument for dissection is Maryland dissector, and there is another blunt dissector which is used commonly in laparoscopy. Maryland dissector and blunt dissector. If you have seen laparoscopic cholecystectomy, there is a strong instrument which is used for extraction of gallbladder, and that is what? Alligator forceps. So Maryland dissector, blunt dissector, these are used for dissection, and this alligator forceps, it is used for extraction of gallbladder. Extraction of gallbladder during laparoscopic cholecystectomy. If you see this instrument, the terminal part of instrument is at the right angle to rest of the blade. So the terminal part is at right angle to the rest of blade. So what should be the name of this instrument? This is right angle dissector. So just like right angle forceps, what? The functions are similar. So this is right angle dissector. See this instrument. Here there is fenestration. You can see that there is curved tip, and if it is going to be closed, what? There is space between the two blades. So between two blades at tip there is space. This is a non-traumatic instrument. It looks like Babcock's forceps. So this is Babcock's forceps. Can you see? This is another forceps in which you can see the fenestration. Between the blades there is fenestration. So what's the name? This is fenestrated forceps. So these are the commonly used instruments during laparoscopy. What's the name of this instrument? This is skin stapler. You have seen the paper stapler. So it is like that. This is skin stapler, and it is used for stapling or closing the skin incision. Stapling or closing the skin incision. You have used that paper stapler. In that you have seen that there is staples or cartridge. So in this also you can see there is presence of staples or cartridges. Whenever a patient is having longer incision, So this is the fastest method to close the skin incision. And we use what? Skin stapler. So here you can see how these are being applied. You can see here. So skin stapler, it is used for stapling or closing the skin incision, and this is the fastest method. It's the fastest method to close long skin incision. Fastest method to close long skin incision. This is skin stapler. There are two suction cannulas which are frequently used in general surgery. One is Yancour's suction cannula and the second is Adson's suction cannula. Yancour's is used to suck the large volumes of blood fluid. So whenever we are going to perform the peritoneal lavage, if the patient is having hemoperitoneum, in those cases we are using Yancour's suction cannula. And if some fine meticulous surgery is being performed, we use Adson's suction cannula because it's having fine tip. One by one we are going to discuss. See first the Yancour's suction cannula. How to identify? So if you see, there is blunt, smooth, rounded tip. What kind of tip? Blunt, smooth, rounded tip. You can see here. Simultaneously, it is having 3 holes. So there is one main hole and there are 2 side holes. How many holes? There are 3 holes, one main hole and there are 2 side holes. If you see, it is having angulated body. So what is the advantage of having angulated body? That this angulated body is not going to obstruct the surgeon's field of vision. So it doesn't obstruct the surgeon's field of vision. Okay, so whenever we have to suck large volume of fluid or blood from the peritoneal cavity, it is used. So generally it is used for peritoneal lavage. Okay, so in which patients generally we perform peritoneal lavage? You have seen in emergency patients who are having perforation peritonitis and the patients who are having hemoperitoneum. So when large volume of blood or fluid has to be sucked out, this Yancour's suction cannula is used. See the second one, this is Adson's suction cannula. How to identify? Here you can see that there is a vent with thumb rest. Okay, and this vent with thumb rest, it gives better control of suction cannula. So this is for better control of suction cannula. In this also, you can see that there is slight angulation, and if you see the tip, there is fine suction tip. So if there is fine suction tip, this Adson suction cannula is used for fine and meticulous surgery. So you can see the comparison. There is fine suction tip, and that's why it is used for fine and meticulous surgery. Adson suction cannula. So it is used in fine and meticulous surgery, like we are using it in plastic surgery, in reconstructive surgery, and in vascular surgery. Plastic surgery, in reconstructive surgery, and vascular surgery. So the name of this suction cannula is Adson suction cannula, and the first one was Yancour's suction cannula. Now we are going to discuss the principles of diathermy or electrosurgery. So see, whenever electric current passes through any conductor, some of its energy appears as heat. So whenever electric current passes through any conductor, some of its energy appears as heat. So in this, the heat produced depends upon heat produced depends upon intensity of current. What? First, intensity. Second, waveform of current, and electrical property of tissue. Which tissue? The tissue through which electric current passes, and relative sizes of electrode. So in diathermy or electrosurgery, see, the heat produced depends on intensity of current, waveform, electrical property of tissues, and relative sizes of electrodes. There are two types of electrosurgery, also known as electrocautery. One is monopolar and the second is bipolar. Why monopolar is called monopolar? Because there is single active electrode. And in bipolar cautery or electrosurgery, there are two active electrodes. So what are the types? So there is monopolar cautery or dithermy, and this is bipolar cautery or bipolar dithermy. Okay, here you can see this is the electrosurgical unit. So there is electrosurgical unit. Now see what are the differences. In monopolar cautery, there is a single, mono means single. So there is single active electrode. This is active electrode. Single active electrode. Okay. Whereas in the bipolar dithermy or cautery, you can see these are two active electrodes. So both are active electrodes. One is known as active and second is return electrode. So in monopolar cautery, there is single active electrode, and in the bipolar cautery, there are two active electrodes. In detail, we are going to discuss first. We are going to discuss the monopolar dithermy. Now see monopolar dithermy, how it works. We discussed that there is single active electrode. If we compare monopolar from bipolar cautery, out of these two, which one is most commonly used? So it's the monopolar cautery or dithermy which is most commonly used. In this case, there is active electrode and return electrode. You have seen in the OT that there is a cautery pad, black colored cautery pad which is applied over back, gluteal region or near thigh. That is returned electrode. So here you can see that there is return electrode applied here. So this is return electrode. Okay, and you can see that this is active electrode. Now see how it works. There is active cable and there is a return cable. From the active cable, alternating current is going to the active electrode. Active electrode is just like the pen. Okay, so here there is a tip and there is a small surface area. So here you can see how it looks like. There is small surface area. Okay, so there is small surface area of this active electrode. So whenever alternating current reaches the small area of active electrode here, the electric current is concentrated. And since there is concentrated electric current, it is going to produce the heat. And this heat is used for cutting and coagulation. So which button is used for coagulation? Can you see here? This is the blue button. It is used for coagulation. Which button is used for cutting? So yellow button, it is used for cutting. How to remember? Mnemonic is blue co. Just remember this. Blue co. Blue for coagulation. Blue co. Now come back here. So see here, active electrode is having small surface area. So here, concentrated electric current. Because of concentrated electric current, what is produced? It is going to produce heat, and this heat is used for cutting and coagulation. So this is the heat which is used for cutting and coagulation. So in the cautery, there is button, blue co. Blue is used for coagulation, yellow for cutting. See, via the return electrode, the alternating current is returned to the return cable. So via return electrode, alternating current is going to return cable and then it is going back to the electrosurgical unit. So how it works? Via active cable, alternating current goes to active electrode. Electric current is concentrated, so it is going to produce heat. Heat is used for cutting and coagulation. Via return electrode, the alternating current is going to the return cable, and via return cable, it is going back to the electrosurgical unit. So how it looks like? This was an image-based question in AIIMS and NEET. So see how this monopolar dithermy or cautery looks like. So there are two buttons. Blue button is for coagulation and yellow button is used for cutting. Now see how bipolar dithermy works. So we discussed that this is the electrode. In bipolar dithermy, there are two active electrodes. So via active cable, the alternating current is going to the active electrode. And see, if the tissue is caught between these electrodes, what happens? There is local flow of current. So whatever the tissue is caught, it gets heated and it gets burnt, and then the current passes or it goes to the returned electrode. So this is bipolar cautery. So what's the advantage of this bipolar cautery or diathermy when some tissue is being caught between the electrodes? What? Surrounding tissues are being spared from being heated up or having current pass through them. So this is the advantage of bipolar cautery or diathermy. You have seen that generally this bipolar diathermy, it is used in gynecological surgery. Generally it is used in gynecological surgery. So how many electrodes? Two electrodes, and both of these are active electrodes. One is known as active, one is known as return. When the tissue is being caught up between the electrodes, it gets heated and it gets burnt, but surrounding areas are spared. So this is bipolar cautery, and this is how it looks. See the effects of diathermy. There was one question related to effects of diathermy in AIMS. So effects of diathermy or cautery. So see, it can lead to coagulation, and the coagulation is activated by intermittent waveform. Two things we discussed, mainly cutting and coagulation. So coagulation is activated by intermittent waveform, and this cutting is activated by constant waveform. This was the question in AIMS. So coagulation activated by intermittent waveform, and cutting, it is activated by constant waveform. What is fulguration? In fulguration, there is destructive coagulation and charring. Fulguration, in that there is destructive coagulation and charring. What is blended waveform? Blended waveform. So the blended waveform is having advantage of both cutting and coagulation. So let's revise it quickly because it's important. Coagulation is activated by intermittent waveform. Cutting is activated by constant waveform. Fulguration is destructive coagulation and charring. And what is the advantage of blended waveform? That it is advantage of having both cutting and coagulation. So these are the effects of diathermy. There was one question related to capacitance coupling in UPSC. So it is known as capacitance coupling, also known as capacitive coupling, also known as coupling capacitance. What are the names? So it is known as capacitance coupling, capacitive coupling, or coupling capacitance. So see what happens here. There are two predisposing factors. First, suppose, what are the predisposing factors? Here you can see there is dithermy hook. If we use high frequency alternating current, first, the use of high frequency alternating current, and second, in this instrument, if there is thin insulation layer. So what's the problem? There is thin insulation layer. So the two predisposing factors are, first, high frequency alternating current, and second, there is thin insulation layer. So if you use metal laparoscopic port, so what? This is a conductor because it's metallic. So what happens? There is transfer of energy to a nearby conductor. I'm repeating, two predisposing factors, high frequency alternating current, and there is thin insulation layer. Because of that, there is transfer of energy. There is transfer of energy to a nearby conductor. If it's metallic, obviously. So whenever this port or this conductor, it comes in contact with bowel, or it is going to touch a nearby bowel. So at the point of contact with bowel, there is stray current injury. So at the point of contact with bowel, there is stray current injury, and this is known as capacitance coupling or capacitive coupling. So high frequency alternating current, if there is thin insulation layer, there is transfer of energy to a nearby conductor. When this conductor comes in contact with bowel, there is stray current injury. This is known as capacitance coupling. Easiest way to avoid this capacitance coupling, easiest way, convert this metallic laparoscopic port to plastic port. So if we use plastic laparoscopic port instead of metallic port, we can avoid capacitance coupling. So how to avoid? use of plastic port. Use of plastic port can avoid the capacitance coupling. What is the name of this instrument? This was also asked in AIMS in the form of image-based question. So this is electrothermal bipolar tissue sealing system known as LigaSure. So this is electrothermal bipolar tissue sealing system. Bipolar tissue sealing system. Okay. If you have seen the laparoscopic surgeries, in laparoscopic surgeries, we are using this LigaSure. Generally, it is used in both abdominal and pelvic surgery. So see, it is used in laparoscopic, abdominal as well as pelvic surgeries. Used in laparoscopic, abdominal and pelvic surgery. So in these surgeries, it is mainly used to seal the vessels up to 7 mm in diameter. So it is mainly used to seal the vessels up to 7 mm in diameter. And you can't believe within how many seconds it is going to seal the vessels. It is going to seal the vessels within 2 to 4 seconds. So what are the uses? Uses, it is going to seal the vessels. Seal the vessels. The question which is asked, that up to what diameter? The diameter is up to 7 mm. And within how many seconds it is going to seal these vessels? It can seal these vessels within 2 to 4 seconds. So within 2 to 4 seconds, it can seal vessels up to 7 mm in diameter. So you have to remember the diameter 7 mm. Apart from vessels, it can seal tissue bundles also and lymphatics. So apart from the vessels, it can seal pedicles of organ, tissue bundles and lymphatics. Tissue bundles and lymphatics. So what is the advantage of LigaSure? That there is minimal lateral thermal spread. It improves vessel sealing with minimal lateral thermal spread. So what's the advantage of LigaSure? That it improves vessel sealing, with minimal lateral thermal spread. There is minimal lateral thermal spread. Okay. So what are the questions which you have to remember related to LigaSure? First, that it can seal the vessels, pedicle, tissue bundle, lymphatics. The size of vessels which can be sealed, the diameter is up to 7 mm, and within how many seconds it can seal the vessels? 2 to 4 seconds. What's the name of this instrument? This is harmonic scalpel. Yes, this instrument is based on ultrasound technology. Important point. So the name is harmonic scalpel and it is based on ultrasound technology. Clear? And see, with use of ultrasound technology, it is used to cut simultaneously seal the tissues. So it is going to cut simultaneously, it is going to seal the tissues. Clear? So what happens here? You can see there is active jaw and there is inactive jaw. So the scalpel is going to vibrate at 20,000 to 50,000 Hz. And here, this vibration is responsible for denaturation of protein. It's not the heat, it's the vibration which is responsible for denaturation of protein. So see, here, scalpel vibrates. This frequency is asked in exam. The scalpel vibrates at 20,000 to 50,000 Hz. Clear? And because of this vibration, what happens? This vibration is responsible for protein denaturation. Right? So it's not the heat, it's this vibration which is responsible for protein denaturation. This harmonic scalpel can divide both arteries and veins up to 7 mm in diameter. So see, what are the uses? Uses of harmonic scalpel, that it divides both artery as well as vein up to what diameter? We discussed that for ligashore also the vessels which were sealed was up to 7 mm, and here also the diameter is up to 7 mm. So what are the advantages of using harmonic scalpel? There is less thermal damage to adjacent tissues, there is less charring, desiccation, there is reduced operative time. So since there is less charring, less desiccation, reduced operative time, and that's why if we use harmonic scalpel, there is faster recovery. So this is all about instruments.